This conference will now be recorded.
A very good morning to you all. We'll wait for 2 more minutes as the participants are getting logging. Uh, Very good morning to you all. Uh, Welcome to all from the Kaher family. On behalf of Principal, Vice Principal, Dean, I welcome you all the delegates and resource person for today's second session on competency-based nursing, uh, competency-based nursing education sessions for today. The resource person for today are Dr. Leena Casey, where she'll be giving an overview course on community health nursing. Dr. Raman Kalia from Punjab will be giving addressing on nursing foundation. Dr. Larissa Martha Sams from Bangalore will be addressing on adult health nursing. Dr. Manju Chugani Dean from New Delhi will be addressing on OBG nursing. And the last session for today at 12 p.m., Mr. Gavi Salimat, Assistant COE of Kaher, will be addressing on the assessment guidelines on the exam section. So today I take a privilege to welcome the first resource person, Dr. Leena Casey. Dr. Leena Casey, Dean and Principal of Enopia Nursing College, Enopia Dean to be University, Bangalore. Ma'am has completed her BSc Nursing in Government College of Nursing, Bangalore in 1998. Ma'am has completed MSc in Nursing in Community Health Nursing in Father Mullah's College of Nursing, Bangalore in 2002. PhD in National Consortium for PhD in Nursing, RGHS in Bangalore, 2015. Ma'am is a POS PG external member in RGHS from 2021. Ma'am is also a Master Trainer in Emergency Nursing Life Support, ENLS, from 2020. Ma'am is member of Indian Red Cross Society, DK Karnataka branch and Society of Community Health Nurses of India, Sochi. Member in Academic Council, Enopia University, and external peers member in Goa University. Ma'am is also editorial board external member in RGHS Journal on Nursing. Ma'am has 31 publications. Ma'am is also a principal investigator for funded projects, and she has total 24 years and plus teaching experiences. So I request Leena ma'am will be Yes, ma'am. You can start this session. Good morning, Sudha ma'am.
Good morning, everybody. Thank you for the introduction. I thank the organizers for having given me this opportunity to discuss the subject orientation of community health nursing. I hope I'll be able to do justice to the topic in the half an hour that is given to me. Is the slide visible?
Yes.
Yes, ma'am.
Thank you. So in the last, from yesterday, this conference, which is very much thought about conference about orienting the nursing fraternity about the competency-based curriculum, which is designed and notified by the Indian Nursing Council, a very good initiative to orient. Because as we bring about drastic change in the existing curriculum, it's very much important that we have more and more orientation programs like this, which all of us may have had in our own institutions and which we have attended, what is organized by the Indian Nursing Council and other agencies. But however, when we plan to introduce the curriculum, especially the deemed universities or the private sector, many of us would have introduced the curriculum already. And as and when we do it, we are finding queries, we are having doubts. So this is a very good way to deliberate and learn from each other. I hope we will have an interactive session. And if we really look at what went on in the sessions yesterday, I'm sure all of you participants would have got an overview of the syllabus, a complete idea of what are the competencies and how they have been organized. To talk about community health nursing, if you look at the introduction of the syllabus itself, it says that the competencies that are essential for community health nursing or to work in the public health area, the mentioned learning experiences and organized learning experience are more than sufficient to practice nursing and midwifery in variety of setting, which includes community health nursing as well. It also mentions that prepares graduate nurses and midwives to wellness, health promotion, illness, disaster management, and many more competencies, which we consider are very essential for community health nursing practice. And when we look at the reference to the codes, here again we find such references in the preamble of the syllabi, philosophy of the program, aims of the program, and the objectives of the program. It's very well specified, and I feel that the syllabus is very much integrated with the competencies across the courses, which will ultimately help somebody practice in the field of community health nursing, because community health nursing separately may not have specific competencies, but it draws the competencies what are enlisted in all other courses that are part of the syllabus. And it's only somebody who is competent with all the courses of study and the competencies listed in across the syllabus that they will be able to function efficiently as a community health nurse in the field. And the core competencies what are listed and the graduate attributes, I'm sure is discussed in yesterday's sessions, and I'm not going to the details of any of these competencies, but just to have a listing of them. So the competencies as listed are patient-centered care, professionalism, teaching leadership, system-based practice, health informatics, communication, teamwork, safety, quality improvement, and evidence-based practice, which is also the core competency of community health nursing. And if you look at, we consider in the field of community health nursing, we consider family-centered care or family centered approach, which we are going to integrate. Professionalism is key to working in the community.
Yes, yes.
Teaching leadership and all such competencies are important, because when community health nursing practice happens, we know that they have to deal with local leaders, formal leaders, informal leaders. We need to have good interactions, so that is also part of it. System-based practice. When we do the system-based practice, we know that we are working in the public health system, and we know that we have to fit into the system and we have to bring about a change. That is possible when we have essential competencies. And we know that public have become very savvy about technology and information that is available worldwide. And as public health nurses or community health nurses, we need to integrate technology. For example, for survey, there are technologies available. Mother and child tracking system is available. We have access, say, if it is ART delivery for people who are diagnosed with HIV, there are technology available. Everything is entered through a system, and we should be able to manage this information and technology. Communication, we consider, is a key competency, because ultimately it is through communication that somebody who will be able to work in the community. Same like how it is important in the general clinical practice in the hospital setup. I think communication is a very key competency that we are aiming to, wherein we are teaching the students to be able to understand the culture, to respect the community, to provide culture specific nursing care, and be assertive in the communication, have skills of persuasion, because you are working in setup where we don't have much control. So communication is key. Teamwork and collaboration. Here we find that we need to work as a team, whether it is a healthcare team or the auxiliaries. We have healthcare workers, the auxiliary nurse midwives, the female health workers, or the LHVs, lady health visitors, or health assistant, male, female, medical officers, pharmacists. There is a whole set of people working in the community, whether it is in the primary health center or in the community health center. Then we have voluntary workers like ASHA workers or Anganwadi workers. We have also lay workers. We have panchayats to coordinate and collaborate. So the teamwork and collaboration plays an important role, and all those skills are listed and experiences are provided in the theory and the practical aspects of the syllabus that is listed. Safety is an important concern, safety of the provider and the people who are beneficiaries of our services. So that's how the safety part is taken care, how we have to be safe and how people should be protected against violation of their rights, and how treatment related say side effects and say immunization safety, for example, how this is important is looked after in the practical part. Overall, so we are aiming at quality improvement initiatives. We are also orienting the students about Indian public health standards and how we have to maintain standards. What are the guidelines that are given for diagnosing a particular disease or doing the treatment? What are the standards available, practice standards available? All these are part of the current syllabus that we are talking about. So it's all about improving the quality through evidence-based practice, and ultimately to see that the health of the community is benefited. So this is very much part of all the courses that are listed in the syllabus. Now, if we talk about competencies and how community health nursing subject is organized, it's also important to know what are the prerequisites if we have to expect a very good product at the end of 4 years of their study. So we have teachers, what is already listed. So the syllabi talks about the student strengths and how many PG teachers. In the second year, how many should be there? In the fourth year, how many should be there? And so this is all about, the teachers. Now, we do not see much changes happening in the number of teachers. It's only specifying about only postgraduate teachers. And about other teachers, there is no mention in the syllabus, but we should not be diluting just because only MSc number is given. We need to allow people, even if we have tutors or any other categories available, we should make sure that each of the subjects have adequate number of teachers who are available for instruction and supervision. And without that, we cannot aim to achieve the competencies that we are talking about. So as it is, 1:10 is the ratio that is specified, and it does mention about presence of a tutor. Presence of a tutor in the community. There is some disturbance. Am I audible?
Yes, ma'am. Ma'am, you're audible. We'll just see that we'll mute the other ones. Can continue, ma'am.
Yeah. So the syllabi talks about teachers and specifically about the presence of a tutor in the community health field who is staying during the stay postings in the community. Now, this mention is made, and it talks about the facilities that are to be available. And in addition to the teachers, whether postgraduate teachers or some tutors who are available, it also talks about working in close coordination with the nursing service personnel. So specifically, if we talk about community health nursing, I think an experience that we provide without working together along with the auxiliary nurse midwife or female health worker, the lady health visitor or the health assistant female, the public health nurses or the sector nurses or registered nurses, it will not be able to make a major difference in the learning. So the colleges, when we implement the syllabi, we should see that it's not just we teachers from the nursing college and our students. We should try to integrate as much as possible, coordinate as much as possible for the programs so that the students will learn exactly what is happening in the community. It should not be focused on just learning or completing the logbook in terms of demonstrating certain procedures. They should be knowing what is happening with the national programs, what is the way in which a particular disease is handled or how a surveillance is done. Although they are little activities, they are very, very important from the point of learning community health nursing. And I think we should focus our attention to that. And with this, being with such personnel working in the community, we will be able to have an overview of the activities, and this will help our graduates to fit into certain roles. For example, now we have the community health officers or the MLHP program. We have many graduates who are applying for such jobs, but if we prepare them in the traditional way where we do an orientation, ask them to demonstrate some procedures and do a health education, and that's it, the posting, or do some survey, they are not competent to take up those roles of community health officer, and thereby there is a need for another training, and which is avoidable and which is not going to happen once the graduates who are going through the current syllabi that we are talking about is going to be coming out. So therefore they should be prepared and their competencies are going to be measured. There is no bridge course that is proposed after this students come out from this syllabi. We also talk about grassroots level workers, Anganwadi workers or the ASHA workers. Lot to learn from this category of people. I think as resources and the teachers should be the ones who should be making a change in this, and this will help us complete our course practical more comfortably when we involve all of these people, tagging them with the auxiliary nurse midwives or tagging them with the Anganwadi workers and doing monitoring, supervision and teaching is the way to meet these competencies. Now, resources in terms of laboratories. We need good laboratories. I'm sure all of you who are attending this session have your own good community and nutrition labs. And what is important is not the size. It's all about the setting, whether people get an idea of how the community is, and about important information being displayed in the community labs, so that day in and day out, when they go to the lab, they know what is the immunization schedule, or they know how to handle a particular disease, or how deworming has to be done. And articles should be as per the lab list. But if you really look at the labs, we focus on the community health nursing bag. We do not know how much of it is being utilized. And I think it is time that we relook at our strategies, and we need to modernize our community health nursing labs. Say, we may teach them how to do Benedict tests, but we need to teach them how to use a heuristic or a diastic, how to do HB using Taliquid's test. But you should also be able to teach them how to use a good handy hemoglobinometer. So unless we invest in the laboratories, in the resources, our graduates will be old-fashioned. They will not be able to function independently and with confidence. So therefore, it's high time we modernize with little things. They are not very costly equipments. But if we modernize and if we try to upgrade our practice, and the community is also going to value our services, in turn, we are able to do researches. The students also feel good to carry the equipment to the community, whereas now they are not comfortable carrying the community bag, and the people also may not feel that lot of services are not provided, or they may not be valuing such services. So it's high time that we modernize our learning resources, especially laboratories, to make sure that such quality initiatives are improving the competencies of the graduates. I think all of us should make a positive change in this direction. Now, coming to clinical facilities, let us say that there are urban and rural places that are identified to provide the services. We have attached PHCs, but how many of our graduates exactly know how the PHC functions? What are the services provided? Are they able to provide services if they are posted as a nurse in the primary health center? If we are not having such graduates, it is a reflection of the competencies that we are providing to the students. And I'm sure we have a problem where the students may be posted to the primary health center for a week, or they may be taken for an observation visit, where they may be focusing on drug delivery or vaccination or something. But integrated learning has to happen. That's only possible with the teamwork and collaborative effort from the primary health center personnel along with the teachers. This direction to bring about competence. Mention about residential posting, 10 to 15 students and one teacher, that tutor that we mentioned earlier. Now 10 to 15 students are in the residential posting. What about the duration? Maybe the duration we have to identify based on the total number of blocks of practicals that we plan. Many colleges are in the urban areas. Are in the urban areas. We have rural training centers. Safety is a concern. Stay is a concern. If you have to, real positions are coming from rural areas. So we need to focus our attention to provide at least some exposure to the students to know how the rural community is, how it is like to work in the residential facility. It's not about going and sleeping there. It's about how to provide 24/7 services when there is a need to provide such services. Important that students get an overview of this. They in the field, say as a community health officer. Community health officers, they tell us they stay in that particular area, and anytime people just walk in, People just walk in and you need to attend to them. It could be a woman in labor, it could be somebody who is bleeding, it could be a snake bite. So we experience a lot of problems. So we can't say that the duty is over. It is about bringing about the attitude to care and to provide that 24/7 services. Own transport and own transport which is at our disposal when we require, and other support services for safety and all that is an important area. Now we talk about community health nursing, and when we talk about the labs, it is community health nursing and nutrition labs that is specified in the syllabus. The subject of nutrition is there with the required number of hours. So we need to modernize even the nutrition labs. We are talking about the clinical facilities and the labs. So we need to modernize. And now when we have modern methods of cooking, modern methods of preservation, about what is junk food, how certain additives are added, preservatives are added, which one is having what impact, and also modernizing the nutrition lab is very important. It's also important to have displays of things that are available. Real practice has to happen, and it's not that the nutrition practice has to happen only in the nutrition lab, and if it is happening in the nutrition lab, it's only the beneficiaries are the teachers who go and see, evaluate, and we make some noise. But what if we shift this to the community? Nutrition lab plus somewhere in the outreach area that is of the community. It will be great learning because, you know, as per the need of the community, they can prepare, community gets benefited. We can also spread awareness and people feel good about services that we provide. This is the approach I think we should follow in order to have visibility for our services and to do good to the community. Now, placement of subjects. You are aware of the syllabi and the placement of subjects that we are talking about. So the subjects, we know applied nutrition and dietetics is there in the second semester with 60 hours and 3 credits. Fifth semester, community health nursing 1, where environmental science and epidemiology is placed, 100 hours and 5 credits. The practical hours are 160 hours and 2 credits. In the 7th semester, we have community health nursing 2 and 100 hours theory, 5 credits, and the practicals of 160 hours where 2 credits are awarded. And in the 8th semester, there is a mention about the practicals, that is 4 weeks, that is 48 hours per week. It comes about 192 hours. So when we talk about all these placements, if you look at the old syllabus, we had it in the second year and in the 4th year. Second year, there was no practical exams and the number of hours and the number of units were few. Epidemiology and environment science was there very much, but there is no separate mention that was made, but it was there in the units of the particular syllabi. If you look at the syllabi, we know that the number of units are exhaustive, 12, 13 units in a particular subject, the number of hours, there is a lot that has to be learned. And let it be not just learning of theory, but application of that theory into practice so that the students will be able to use these skills and knowledge in their day-to-day practice and make a difference to the field. Scheme of examination. Here again, we know where it is placed in the 5th and the 7th semester. Internal marks are 25. End examination, that is end semester exam, 75 marks each. 3 hours exam and 100 marks. Now, the internal examination is important. There should be marks obtained from the tests, the sessional exams, model exam, etc. And then we need to have continuous comprehensive assessment. We should not dilute that internal assessment component here. We need to focus on ensuring that these are earned and that we give adequate attention to the test and the examination. And it should not be majorly continuous comprehensive assessment, writing some assignments, etc., and considering very little weightage for tests. That is not a good approach to follow. Now, a scheme of examination, practical is where we need to do more discussion on, that is community health nursing 1. If it talks about having one internal and one external examiner, I'm sure all of us are doing that. But there is a specific mention made for all subjects about assistant professor designation person being an examiner. So it is the designation plus experience, both are counted. It's not, designation is important. Internal marks are 50. I feel there is adequate justice given to the practicals, because all through the practical, students involve themselves in lot of activities. There is lot that is learning, and because internal assessment is 50 or 50%, I think they will take keen interest to learn the skills that are essential, and they will be able to attain focus and attain those competencies. OSCE 15 marks for the end semester examination. OSCE you give 15 marks, directly observed practical 35 marks. So this is something that is clearly specified now, although many of us were doing OSCE for the students as a part of a model practical or as a part of sessional practicals. We were doing it, but now that it has become a mandate, I think we can focus more on the skills that are to be attained during the practical. Directly observed practical, again, the focus should be more about communication skills, whether the student has attained, whether the student knows the rationale behind certain activities, whether the student knows to apply the theory to practice. So we need to have our evaluation formats designed in such a way that we cover the core competencies in the evaluation form, so that we can certify that they have met these competencies. In the community health nursing 2, again, the specifications are the same, OSCE 15 and directly observed practical 35. So with 2 practical examination, maybe we can make a difference. See what we cover in the 5th semester. We can even have a categorization. What can be done in 5th semester? What more can be done in the 7th semester? Instead of ending up doing the same thing in the 5th semester and the 7th semester, we can upgrade as to which skills we will measure in the 7th semester and in the 5th semester, so that we can concentrate on measuring those competencies as well. Now, the 8th semester competency assessment talks about 5 examiners, 3 internal. In that, if you talk about 3 will be internal, 2 maybe from some other specializations. So 20 internal assessment and 20 end semester examination is the scores given. Excuse me, can you hear what I'm talking? Could you please? So we get 20 marks for internal assessment from community and 20 marks from the end semester examination. So out of the 20 marks of internal assessment, 10 marks are coming from clinical evaluation, 10 are coming from OSCE. So OSCE cannot be only the end examination. The students can practice and we can evaluate for internals also. And end semester exams, again, integrated OSCE is what is planned. Out of that, 20 scores or stations can be arranged in such a way that the most important core competencies can be measured during the integrated OSCE examination. So therefore, we can ascertain that certain skills which are planned, which are designed already, are measured. And when we do the integrated OSCE in the competency assessment at the end, we have to make sure that there is no overlapping, because many of the community health nursing competencies are either falling under pediatrics or falling under OBG. So we have to make sure that when this planning happens, all important competencies of the course are measured, wherein we have to see that there is no overlapping happening. So this is about the scheme of examination for theory and the practical. And I will be failing in my duty if I don't mention about community health nursing competencies and how the elective courses and mandatory modules are going to influence the way community health nursing competencies are derived. And I'm sure some of the speakers would have already talked about it, but to mention about the mandatory modules, all of these modules I consider as very important to attain the community health nursing competencies to work independently and efficiently in the community. And all of them are placed across different semesters. And if the learning really happens, then we won't face a difficulty of bringing out incompetent graduates. And I hope we will be able to change the scenario with this. Now, if you look at the mandatory modules, health assessment is considered to be the most important competency for community health nurses, because you don't have other people to assess. You should be able to do quick assessment, identify the problems. You should be able to look for the differential diagnosis. You should be able to refer people. These are all some important tasks that we need to do. Basic life support is important because we may face emergencies in the community as well. Fundamentals of prescribing. Now, if you talk about the competencies of community health officers, it is part of the part of their job is also prescribed, in the sense they may be having standard orders, standard instructions that are there. But however, knowledge of pharmacology is important. And if you talk about newborn care, if you talk about IMNCI, these were all part of the syllabi somewhere. But as this is given, the overlapping is avoided. I hope each of these departments take care of these competencies so that we will have a smooth run at the end, where the graduate attains all the competencies listed for the program, SBA module, safe delivery, app, etc. If we talk about elective modules, again, I feel the elective modules are very valuable to attain the core competencies that are essential for community health nursing practice. Soft skills, I think, is very important. And we have the rise of non-communicable disease. So diabetes, for example, personality, it will help us function as better personnel. And all of these are very important, and we should be able to identify or guide the students to choose a particular elective so that they will be able to develop themselves. So we know about how certification is happening, that if it is electives, that the institution or the external agency may be able to certify. Here we talk about the MOOC, massive open resources that are available, MOOC platforms like Coursera or Swayam courses, NPTEL courses, courses which are already available for various national health programs. All this can be referred to and students can be certified. So modules and community health nursing practice, as I said, is going to be of great value. So when we talk about middle level healthcare provider or community health nursing competencies, as I mentioned earlier, right now we have in the old syllabus, we are separately certified that the students of our college or the university have completed the middle level health provider course, because it was not integrated into the syllabi. There was a separate syllabi and logbook and all those things. But this new syllabus incorporates all of that what was separately existing into this curriculum. And as discussed in the preamble and philosophy objectives of the course and the specific learning outcomes, all of those competencies are listed. Therefore, there is no need to have a separate MLHP program parallelly running, because everything is integrated. So now it is for us to ensure that all of those competencies what are required are attained in the particular course. For example, about neonatal assessment, it's the Department of Pediatrics which will ensure that this competency is attained, so that you don't have to worry about MLHP course and think of again following it up. So therefore, it is a cooperative effort that is happening to ensure competencies. And I'm sure our graduates coming out of the new syllabi will be more efficient in terms of their skills and knowledge, so that they are able to take up the positions as community health officer or any such positions that come up in the future. What is the way forward with the new syllabus? The way forward is, see, everything is given in the syllabi. Now, it is for us to identify which are the competencies to be attained in which of the semesters, and among the competencies which you consider core, and in that core, how you ensure that the student learns, each student learns, and how you are listing those competency as must know or desirable to know. So must know competencies are the competencies which must be attained by every student in your class. So this is the way we can ensure that the attainment of the program outcome happens and the graduates will be competent. The role of teacher is very key to the success of the vision of this new syllabi, and we should maybe reorient ourselves. We can think about bringing about a positive change in our approach to delivery of the curriculum, the plan of the curriculum, monitoring that we do, or the pattern of examination. How do we go about measuring the competencies and understanding the learning value of each of those competencies when we organize the learning experiences. So our role is great, and I hope all of us will be able to shoulder this responsibility of bringing about competent graduates in the days to come. So I have referred the INC regulations and the MLHP guidelines in addition to the core competencies. Now the floor is open for discussion. You may ask questions, or with your vast experience, if you have something to contribute, you are welcome. Thank you.
Thank you, Leena ma'am. Anybody is having any question can be asked. There's a question in the chat box, ma'am. It's regarding the subject of nutrition and dietetics. They have asked for, there's no practical hours in the syllabus.
Yes, there is no practical hours in the syllabus, but if you really look at the syllabi, it can be integrated. Although there is no practical, there are subjects. For example, in adult health nursing, there is nutrition and therapeutic diet. So maybe integration is a better way, but if you look at the nutrition syllabus, the syllabi has more or less remained the same except for few of the aspects. As separate theory is not there, it is one concern, but I hope we will be able to provide some of the theory practical integrated classes so that students learn better, and with the practicals of the subjects that follow in the later semesters, because adult nursing, pediatric, OBG, community, all of those subjects are placed in the later years. So there should be integration that is happening horizontally, so that the students, what they learned in the theory will be practiced in the later core subject implementation.
Thank you, ma'am. Thank you, ma'am. I think this is clear. So Dr. Bindu John has said, it was a question from Dr. Bindu John. Anybody is having any other question, any doubts? Leena ma'am, thank you so much for orienting about the community health nursing, which is in the semester of 5th and 7th. You have detailedly explained about theory and practical aspect, explained the modules, including the elective modules also, You have told the importance of soft skills in community health nursing, and you have also explained, or you have told about how the MLHP also is integrated with the community health, and you have motivated the teachers, all the faculties for prioritizing the competencies. Thank you so much, ma'am.
Yeah, thank you. I have actually put the syllabi, but I thought in case there is a need, I can open it. As there are no
Yes.
questions concerning that. Okay, I hope things are clear. As we get into the process of implementing, we may come across challenges, and conferences such as these have given us a platform to interact. I thank the organizers for having given me this opportunity to share this part of community health nursing. Thank you very much. Have a fruitful learning. Thank you.
Yeah, thank you so much, ma'am. Thank you.
Thank you, Dr. Leena. It was so basic and informative, and I appreciate that you told the common practical problems for the lab and in the community for students posting, residents, and you also address the faculty requirements. And in chat box,
Yes,
people were asking that there is no nutrition lab this time, but I read somewhere that now nutrition is going
it's
to be a part
together.
of the community. Yeah.
Community
And
and
my
nutrition lab
college,
is what is.
yeah,
But my
in my
only
college,
doubt is, yes, ma'am.
we have the community and nutrition lab side by side only. So I thought, okay, no need to change anything. So,
Okay. So now,
and
as of now, maybe in terms of subject allocation, there can be a concern, because if it is coming under community, the workload arrangements, whether all of those nutrition topics are to be dealt by community faculty. So these are the things that we will have to sort out at our own places. Thank you.
I think we can, I mean, in my college, I think the pediatric one faculty and OBGYN faculty used to manage the nutrition lab. And those who would manage the nutrition lab, and some of them would teach different units, and I would put them as internal examiners also. So I think if you have lack of faculty and you have different faculties managing different things, I think they will help you with because it is very difficult for limited community faculty to deal with all these things. I think for these subjects, nutrition, psychology, sociology, biochemistry, and physio, we have all teachers who get
Yeah.
involved, and they are a part of the internal examiners also. What I liked about your this was like you were telling in the PHC staff. The
Yes.
other day I visited the PHC for a breast cancer screening program, and I was interacting with 5 nursing staff there. There were 2 staff nurses and 3 ANMs, long back our own passed out girls. So all the national programs which are rolled out, like they were not getting the menstrual pads since 2 years it seems. We had no that
Yeah.
what is it menstrual hygiene scheme, in that they distribute free menstrual pads. They're not getting, it seems. Iron folic acid distribution has stopped. It is irregular, it seems. Then I said, do you have satyas and peer educators in the community? They said, no, ma'am. And I was thinking that I teach it at a national level in the INC workshops. And here in the PHCs only, there are so many this. Then I thought it will be very interesting to do a study and find out whatever is there in the National Health Mission in different states. Is it being rolling on, well, and if there are any difficulties, can we, some of us, propose कि ये नहीं हो रहा है, because government में कैसे होता है, sometimes things are there, not there, and if these things are not there, like how our students will go and attend. I believe there is a adolescent health clinic, sexual and reproductive clinic should be there in sub centers PHC. They said only once in a week there's one Sneha clinic where adolescents come, and I presume that every day, like, there is a walk-in clinic as per the theory which I teach. So these
Yes.
things are, uh, and then they have some adolescent health days where those peer educators come, and with the block educator and the ashas, but nothing like that. They said as a hey nahi Satya. Then I was, oh my God. So this is a big gap. And
Yeah.
good that INC has included all this in the syllabus now, so that all the faculty and students will be knowing when they go to the PHC. It is not that we go in our bus, like a horse which is tied. We go in our bus, we have our community bags, we go to the homes, do the home surveys, do our project presentation, eat our lunch, come back, because somewhere there are no residential things. We don't know what is happening in the PHC. Okay, we want to do a ANC checkup, we do on our own. We want to do something, we do on our own. But if the students
Yes.
participate in the iron and folic acid distribution program, they participate in the albendazole deworming, which happens every August and February. If they learn how they indent it, then they are a part of the system. They learn it. Tomorrow they go as CHOs also, it is easy for them. So I
Yes.
found these gaps, like, because I'm a OBG person, I don't visit community much, but we went that day and I saw all these things and I was wondering in my mind ki what will happen, like na itne sab gap
Yeah.
mein new syllabus mein to everything needs to be ideal to teach the students, and
True.
these things are
And
not in our
COVID has
syllabus.
made a change, ma'am. I
Yes,
personally felt COVID has made a change because
yes,
we just kept aside our rigidity with the theory block, practical block, home visit and all. And
yes,
we were very open to the public health department and vaccination programs, home visiting, then collection of swabs, posting to CHC, whatever they have asked, we have done, and the students felt it was wonderful. They
yeah,
gave maximum immunization in this period than whole of their 3 years. So it was
yes,
great learning.
yes,
So
that I
we
agree
cannot be
because,
rigid. Yes.
yeah. See, if you see all over India, who has given the vaccines in the huge vaccination drive? Even our department, our students were doing vaccination drives, the Indradhanush, Pulse Polio. They want us, like the DHO will call and tell, we want your bus, your students. They go everywhere and like they are doing that. That I agree. COVID has really this. And if one thing which I wanted to tell was, all over India, it was only the nurses who gave the vaccines. They collected swabs in frontline areas. But whenever it comes in the newspaper, nobody says that there was a huge COVID vaccination drive done by nurses. It is only healthcare workers, healthcare workers. So healthcare worker can be anyone. So that particular acknowledgement has to come for us. That is sometimes I feel sorry about. Just
Yeah.
expressing because we are all faculty, nursing people. So
Yeah, at our own levels, like in the district level, they have given us appreciation certificate for the contribution towards vaccination drive. That's because we need it, we are asking it openly, and they give
yeah,
us. But it should be reciprocated when services are provided.
yes, Leena ma'am. Thank you for a
Thank you. Thank you.
interesting session. And chalo,
Thank
thanks
you,
a lot.
Leena ma'am. Thank you so much,
Thank you.
ma'am, for
Thank
all
you.
the clarifications.
Next.
Okay, good morning to you all again. As we have completed with the first session on community health nursing, now we'll be moving to the second session by Dr. Raman Kalia ma'am on nursing foundation. So Dr. Raman Kalia ma'am is a principal of Saraswati Nursing Institute, Punjab. She's graduated in 1984, post-graduated in 1993 in subject medical surgical nursing, and won the Punjab University Gold Medal for standing first, and also won the Best Thesis Award. She has completed doctorate in pediatric surgery in 2003 in PGIMER. She was awarded WHO Fellowship in Children Day Care at Bangkok, Thailand. She was faculty at National Institute of Nursing Education, PGI. Now she's a former. She has worked there for 25 years. Ma'am is author of Nursing Research and Statistics and an Indian adaptation editor of textbooks of pediatrics by Dorothy Marlowe, editor of Nursing Research and Midwifery Journal, founder president of Nursing Research Forum. She is guide to PhD scholars under Indian Nursing Council Consortium and at Baba Farid University of Health Sciences Faridkot. She is also a member of various professional bodies of the country. She has presented number of papers in national and international nursing conferences. Ma'am is having more than 50 publications in various nursing journals. Ma'am has also taken the various research projects. Welcome, Raman ma'am. Thank you for giving us time. I know yesterday you were traveling and that all this busy schedule you are giving us time. Thank you so much, ma'am. Ma'am, one more thing is, as we have started with the syllabus in our institute, and we are going with the first batch of first semester students. And next month we will be going for the first semester exams. So at the end, we'll be asking the coordinator, Dr. Manjunath Sogla, Department of Nursing Foundation, to talk on his experience, and he'll be sharing at the end of your session, ma'am.
Good morning, ma'am. Good morning, Raman ma'am, and hearty welcome to the webinar.
Good morning. Good morning. I am so very happy and delighted to join today. Unfortunately, I could not join yesterday. Can you enable my screen? Am I audible?
Yes, ma'am.
Yes,
Ma'am का screen share enable कर दे हाँ.
yes. Yeah.
Am I audible today? Am I
Yes, ma'am,
audible?
you're audible.
Nebula?
Yes, ma'am, you're audible.
Okay.
Thank you so much.
It's nice seeing everyone and listening the first presentation. It's always a good opportunity to interact, learn, and share things and our experiences with each other. At the outset, I would like to thank the organizers to just give me an opportunity to talk on the new syllabus. Of course, the syllabus has been rolled out, and many of the universities and institutes have already implemented it. So we also have implemented the syllabus in our university. This is a state health university where we have already implemented this syllabus. And of course, in all the meetings yesterday as well in the Faculty of Nursing Sciences, the discussion goes on related to the implementation of the syllabus, and this kind of workshops are good opportunity for all of us to learn and know things from each other. As far as the syllabus is concerned, I hope the speakers yesterday also have deliberated certain basics of the syllabus, the philosophy, the competency, and other things. So I would not go into much detail because we have the half of the things to be done in the later part of the presentation. So I'll just talk about the topic which is given to me is for discussing the nursing foundation subject. All of us are familiar that nursing foundation is a very, very basic subject as far as teaching of nursing is concerned. And in this syllabus, the subject is spread over 2 semesters, semester 1 and 2, where the subject has got theory content, it has got practicals, some lab hours, and of course the clinical placement for the students in the hospital for various hours. And in the hospital, they are to learn and practice various procedures and competencies. Learning is also to be taking place in the hospital as well. So as far as the first semester comes, there are 6 credits and 120 hours given in the syllabus. In this 2 credit hours and about 80 hours are to be completed in the skill lab. Now skill lab competencies are also listed out, and in the clinical area, the students will be practicing for the clinical posting. This course is particularly designed to help the novice students to develop knowledge and competencies. Now, all of us are familiar that the students when come out and join nursing after +2, many of them are very, very new to the hospital environment, even to the laboratory things and the nursing labs. So they really know from the basics. The ABC of nursing starts in the nursing foundation course. Also, then they have to develop the comprehensive facilities and competencies for caring the patients. In this, the nursing process approach has to be used. And this semester foundation course includes a mandatory module of first aid. That also is the part of the course. In the second semester, of course, this will include the health assessment as a mandatory module. So these 2 mandatory modules have to be finished along with nursing foundation. These are, of course, going to be the basic for the next adult nursing care and other subjects later on. In this second semester also, we have got skill lab and credit hours, and of course the clinical posting and about 320 hours in the various areas of medical surgical wards of various hospitals. In the syllabus document which is given and circulated on the website, and all of us have now got the hard copies with us. Shortly the printing of the syllabus and other things also will be done by INC. But as far as the content is clear, whosoever has implemented the contents are with us. We are familiar with various teaching learning methods, various evaluation and assessment methods. So it is important for us as teachers to implement the syllabus in whole spirit of what it is given for. And we of course have to bring change and use these newer things. Of course, there must be some things which are already existing, but now we are having more of the implementation in new ways, keeping in mind the newer technologies, keeping in mind the new facilities now. And we are supposed to be all utilizing that for the benefit of our students, so that after passing these graduates, the new ones, will be little different in as far as the competencies are concerned. And this foundation course of first year is going to be their base for the next 3 years. So from that angle also, the nursing foundation subject is very, very important, and the teachers have to pay attention. Now their concentration is the course is curriculum is new, so implementing the course and as well as teaching the course. However, nursing foundation will not have the exam in the first semester, but teaching of nursing foundation has to be started along with the other subjects, because the scheme of examination is also a little different in this syllabus. In first semester, we are not having the nursing foundation exam, but the clinical and theory hours of teaching has to be completed. The nursing foundation examination is going to be in in the second semester. So all of us are clear about this internal assessment and the university examination, the external weightage, how to derive semester assessment, and how to compile the assessment. All these things are already there. However, some details and new methods, etc., have been spelled out in the syllabus, and we should be paying attention to all those new things as well. The competencies we are all familiar with has been listed out, spelled out, which competencies we want to achieve in the first and second semester. Of course, there are core competencies explained by Dr. Leena in the first presentation as well. These core competencies are going to be actually the base for the whole nursing course. There are going to be specific competencies with each subject as well. But as far as the foundations are concerned, the healthcare services, code of ethics, principle of effective communication, recording, reporting, the competency monitoring, vital signs is going to be this important unit in the foundation course, biomedical waste management, mobility of the patients, etc. These are the common competencies which are going to be achieved by the students in the end of this first semester. And the first semester module of first aid also will be included as a compulsory module in the semester 1. When we come to the theory units teaching, in the theory units of 1 to 3, I have only given the titles of the units. The detailed contents are specified. And now when we see the syllabus in great detail, the teaching learning methods and assessment methods are also spelled out simultaneously. So wherever the theoretical concepts of these cognitive approach of our assessment is concerned, these are going to be assessed through essay type, short answer, or objective type tests. And for these 3-4 units, the teaching learning method is going to be lecture cum discussion, as has been specified. The evaluation method of objective type earlier was not compulsory, but now in the scheme of examination, it has been spelled out by INC that there is going to be some small essay type questions, then short answers, and a number of MCQs. So making MCQs, having a practice of attempting MCQs in the examination hours is also going to be a newer evaluation method for all of us. And while conducting the final examinations, also it has to be seen how the evaluation as prescribed by INC, comprising the essay type, short type, essay type, and objective type questions, the students are going to attempt in that specified way. Maybe some time in the initial has to be given with an OMR sheet. In the initial period of the start of examination, some time can be allocated for attempting the objective type answers so that OMR sheets can be collected in that specified time, and later the students are given about 2.5 hours for attempting the paper. All these things can be decided and planned at the individual institute and the university levels also. It's to be seen how objective type answers will be by the students. Yeah, when we come to the fourth unit of semester 1, another important topic as well as a very essential component of nursing, the communication. In this method of learning activity, role play is mentioned. Now, otherwise role play we are not preferring much. But many times we are having some components or some topics on which our students make very innovative role plays. But now it is when it is added in the teaching learning activities, maybe the teachers also have to practice and devise role plays in various topics which have been given in the syllabus. So communication is one way maybe two teachers can interact and the students can pick up how to have a therapeutic communication. So these are going to be various methods of teaching which the teachers need to practice and teachers need to adopt now for teaching various theory topics. This is also another important unit and a topic for the first year students, where you have got more component of practical lab. When we teach the students the theory of temperature, pulse, respiration, etc., how to measure that, demonstration, redemonstration after the theory, then in the lab you will be telling the students how to record these on the sheets, some OSCE examinations, etc., some stations or scenario-based learning, scenario-based evaluation later in the labs has to be supplemented for teaching the vital signs unit to first semester students. Again, a very practical topics and very practical content of the theory will be in this 7th and 8th unit, which comprises of practical things in the hospital. Now, when we post the students in the hospital, the students will see a sterile pack. If as a teacher, we don't tell the student how this pack has been made sterile, what are the mechanism of autoclaving or sterilization in the hospital, maybe a visit to the sterilization department of the hospital or small video presentations, so that the students are oriented to the practical things as well. As we are discussing now, always there are gaps in the hospital, working hospital environment, and what we teach in the theory, as ma'am was now telling for the PHC functionings after the first presentation we had. In the hospitals also we see a lot of gaps. Many times the students are familiar with the things, but these equipments, articles are used in different way, or the picture shown in the classroom or the lab is very, very different than the actual thing. An autoclaving machine is of 10 types. Maybe in the book, the picture is different, and in the hospital existing is a bigger machine. So it is very important for the teachers to show them the exact things and relate it to the theoretical concept, so that the student has got a basic understanding how these swabs are made, even very small thing, how a gauze is cut and rolled into various pieces. In some hospitals nurses may be doing, in some hospitals the servants may be doing, and when the pack comes to the nurse hand, it is just in shape. But it is very important for a student to know how it is made, who is packing, how it is packing, at what temperature it is done. These are very, very basic things which are going to be for other next 3 years a base for them. So in first semester, these basic things in the hospitals have to be oriented to the student. Sometimes we think that the student must be knowing, but student has to know all the things when teacher tells. When I said the students are after +2, so when they are going to the hospital also first day, maybe you have to tell them even the use of small things, the patient locker, what is the significance, why we are keeping, how we are cleaning, how we are maintaining, and who can help us in doing this if there are ward servants, how to get things, from where to get things. These are very basic things for the students to know, and when they are working in the hospital. In the units 9 to 12 also there are various units, various comfort measures, safety of healthcare environment, mobility. For these also various methods of teaching and the assessment methods are there, which comprise of role play again and many demonstrations, etc., which the student maybe for various positions, shifting from the bed, in the lab can be taught to the students the use of stretchers, your use of crutches, the various positions, how shifting the patient, all this can be practiced in the lab, and then the students can observe the body mechanics, the various mobility things in the hospital. So, but as far as the practical in the hospitals is concerned, the first semester students, many times what happens is when the students are posted, they are straight away taken to the labs or straight away taken to the wards by the staff, and they are supposed to be doing whatever the staff says. And this always happens that the students are not trained, for example, in the first semester to perform certain skills, but they pick up the haphazard things from there. They observe haphazard things which is going on in the hospitals. So many times as teachers or as clinical instructors, we have to intervene and tell the limits of the students' learning. What skills now the student can pick up in the first semester, to which things the student is already oriented in the class and lab, and those things only can be shown and explained to the students. But of course there is a lot of indirect learning also takes place in this hospital for the student. For example, a student has gone only for 2 days and the students see a death. Death has not been taught in the class by the time it has not been discussed, the skills have not been done. So it's very new experience for the student, and many times we have seen students frightened when they see a dead body, because earlier in their life, before entering nursing, many of them have not experienced this atmosphere of death in the hospital, and of course it has not been taught in the class. So many times we have observed that the student comes in an awkward practical situation. So at that particular moment or during when the student observe this kind of things in the hospital, the role of teachers become more important to help the students. Every time we have to be with the students. That's why we say the supervised teaching learning practice in the hospital, because when we post the students, we come across various problems and various challenges. In this first year course, we have this first aid module for which INC has given various resources of this Red Cross Society or National Disaster Management, from where we can pick up this module. And this module also has to be assessed later on. When we come to the clinical practical hours, for the 160 hours, the student will be placed in the hospital, and I said various practical things and various observation visits, observation components the teachers have to facilitate for the learning of the students. We have to think from that angle that each small thing should be shown to the students so that the students get an idea about it. The student may not be knowing very basic things, syringe, parts of syringe, various type of catheters, rubber tubings. When they see the use of all these things in the hospital, it gets imbibed in their memory, and when we relate all this teaching in the hospital and the lab and the theory, it becomes an easy thing for the student to pick up. For the skill lab also, in the syllabus, the various competencies have been listed out, various methods of teaching in the skill lab have been listed out, how each skill has to be taught, demonstration using the simulator or using the mannequin also has been spelled out in the document of the curriculum. I'm sure everybody must have seen that, so I have not reproduced, but all these methods should be specifically given. And one thing as a teachers, we must keep in mind, these are guidelines of the curriculum as specified by INC. This minimum we have to do, and everywhere we are free to be putting more effort in implementing the course curriculum. Because the curriculum is provided, implementing is the responsibility and duty of all the teachers, all the clinical instructors, so that whatever is these guidelines are given, we should expand and explain more than that. We should not limit ourselves to this, and while implementing and deliberating the content to the students, we should be using more and more various methods, various innovative techniques, various teaching things, various demonstrations, or whatever comes our way, just to explain the students, and so that their learning can be supplemented and added. When we come to the second semester for the nursing foundation course, because this course is having spread over 2 semesters. In the second semester, 40 hours health assessment module is important and is compulsory module. Health assessment, we all know, is a very basic thing, and earlier also we are practicing. But now this health assessment module has been specifically put in the module thing, because compulsory modules are listed so that the students learn how to make the health assessment and use the assessment methods for the diagnosis and planning of the care and evaluation, etc. From that practical angle, health assessment module is important. While teaching the theory content for the second semester, we come to the basic care needs of the patient, meeting all care needs of the patients, and nutrition, hygiene, elimination, oxygenation, diagnostic, administration of medication is also a very detailed topic, and once for all learning for all the students after the first year has to be practiced for all next 3 years. Of course, these units have got contents of these theory topics to be taught, as well as the assessment methods by using various teaching learning activities of various films, role plays, and the assessment methods are going to be same for these theoretical units. But a lot of these theoretical units is going to be our base for the clinical practice of second semester, where we have got 320 hours of clinical practice, and students will be practically posted in the all general, medical, and surgical wards. Second semester clinical is going to be very hard clinical. Posting for the students' learning is concerned. So in this second semester, teaching learning in the clinical is going to be very challenging for the teachers, because whatever they have taught in the theory content in the classroom, many of the things will be new and have to be put an effort by the teacher to show the students each thing, and the skills are to be learned in the clinical area. In these theory units as well, we continue with meeting the social needs, and much of these stress adaptation and cultural diversity units contents. Also, the nursing theories are part of this course content in the second semester, and of course the teaching learning activities and assessment methods remain same. The assessment methods of OSCE can be practiced. The scenarios can be listed down once and planned, and we can have the students rotated in the groups. In the lab also it can be practiced, so that the students are oriented to much of the clinical things, the decision makings, whatever in their whatever capacity they can do. It is good for teaching the students the second semester all these practical approaches. The clinical practical, as I said, for the second semester is going to be very much detailed. It is actually the 16 weeks as prescribed, about 320 hours in various medical surgical wards. Now, many of the hospitals are having the shifts for the students from the beginning itself, or in some hospitals you may have a 3 to 4 hours clinic and later part of the day for classes as a daily routine. But in some hospitals, the students may be going for 6 to 8 hours clinical in the straight clinical blocks type of arrangement for giving the clinical practices. This depends upon various institute practices and the hospital permissions and the various university guidelines, etc. These things are different. When suppose we are putting the student for 8 hours in the second semester, or for 4 hours. So on those 4 hours or 8 hours have to be utilized for the student learning. Of course, the teachers have to be very alert in seeing what type of opportunity, what type of skill can be practiced, learned, demonstrated in the hospital, and we are supposed to be utilizing various resources present in the hospitals. Direct learning, indirect learning, experiential learning, all these principles of learning and teaching the teachers have to be keeping in their mind, so that they can facilitate and help the students when they are working in the clinical areas. For second semester also, some skill lab hours and credits have been specified, and the mode of teaching also. A lot of return demonstrations can already be performing in the labs before the students go to clinical, because it's very helpful always to complete the demonstration, re-demonstration, so that later the student, when they are working in the hospital, they can just practice and enhance their learning and improve upon the competencies in the clinical area. Also in the clinical requirements which have been specified in the practicals as per required for the students, history taking, physical examination, the usual clinical criteria, requirements, writing works. I personally feel the writing work should be avoided or somehow organized in the hospital, because there are a lot of infections everywhere. If the students spend most of the clinical time in writing these kind of requirements, they miss very, very practical things. It's my personal opinion, and I feel this should be discouraged of carrying so many things in clinical and writing. When we're putting the students in the clinical area, we should be with them to see how they work and let them learn how to work. Of course, writing and recording is one part, but as part of clinical experience while being student, if the students waste a lot of time in the clinical area for writing and maintaining these assignments and files, I suppose the clinical time is wasted, which can be actually used for practical working. So somehow we should be organizing and maybe doing justification to the work of clinical area, as well as writing the assignments of clinical area. As teachers, we can be thinking and working upon it, how we can help the students for making them work practically, because that is important for the hospital. Lot of teaching takes place when the teachers take nursing rounds on care of patients. Lot of discussions and again practical things, maybe looking after an unconscious patients, giving RT feed, showing them various patients, type of equipments used on patients, and all these things can be explained by the teachers while conducting nursing rounds related to the care of patients in the hospital. So a lot of clinical teaching will take place in the hospital, and of course we are supposed to be seeing as teachers the clinical requirements done by the students and all. Okay, when we come to conclude, what the important thing, as Dr. Leena also said, the way forward or future directions is, the important thing is, of course, going to be a role of faculty. We all know that we have learned many things from our teachers, and I'm sure till today, while teaching many things, we are reminded of our faculty, even till today after 40 years. So the role our teacher plays while teaching is a very, very important role for which we all have to be very, very careful later on. And always when we are working with the students, we should be very, very responsible as our own role as a teacher, and responsibility towards our students. So the effort and the level of instructions we give to our students is also going to be part of their memory, part of their life and learning forever. So that's how the teacher has to make that effort of using various kind of experiences. I'm sorry for this spelling mistake. The variety of learning the teacher can facilitate in the while deliberating it to the students in the hospital is going to be very, very important. Maybe small things, as I told, the death or dead body. If as a teacher someone can help the 2-3 students to show the dead body, perform the care herself, maybe handle or counsel the relatives herself, the students can observe that the teacher can do this and the teacher is doing this, and they may be little hesitant, and they may not feel very stressed while working later on. So small things teaching will make difference, and we are able to make change in the behavior of the students, and of course we can facilitate learning. As of course specified in the syllabus itself, there are a lot of innovations required in our teaching methods, which now using various kind of technologies wherever possible, whatever resources you have, you can be utilizing that in while you deliberate it to the students and help them in the clinical area as well as in the classrooms, labs or skill labs, etc. Another thing important from the syllabus point of view is the discussion on the logbook and recording of the competencies. We all know now the logbook is also part of the curriculum and has been given by INC. The maintenance of same logbook starts from the very first semester, and it is important to keep a record Now this records again will be maintained at the individual lab, maybe individual institute level, or the, because some things will be done in the classroom, labs, and then later on practiced in the hospitals. So logbook has to be an essential part of the maybe student learning from the beginning itself, that the logbooks, as we are teaching the students, we are taking demonstrations, demonstrations. Student will be performing some competencies first in the lab in front of the teachers, then later on in the hospitals. So these various records have to be kept somewhere recorded by the teacher, and maybe later put in the logbooks, or simultaneously, as well as familiar and feasible to all the teachers and the institutes, whatever. The maintenance of logbook is going to be a very, very essential responsibility for the students. At this moment, we are not very clear, but maybe these logbooks may be useful at the end of 4 years when we are having exit exam as well. Maybe we want to see the record of the competencies performed by the students, learned by the student, or somehow these logbooks may be helpful for maintaining and keeping the records. So all these were just very basic things for implementing the nursing foundation curriculum. I'm sure many of the universities and the institutes who are already implementing will have now by now come across a lot of practical things while implementing. So I think it is very good to share with everyone, if someone else can also contribute how they are implementing and what difficulties they have come across, and what are the new things which they are finding it interesting to teach the students. I would like to listen to someone who has got, because some universities started the syllabus in July or September. Many of the institutes and the universities started at least 1st September, which was the cutoff date earlier. So that's how, like ma'am said, now your university is now nearing the half semester examinations, but all are running at these semesters at different pace. So it's always good to share. I would like to ask and know the practical things, or what you have done, and later part of presentation sir will continue. Thank you.
Thank you very much, ma'am, for your brief information about the nursing foundation subject. And we are very happy that we got a company in the structure of the semester system. Initially, we started with a semester, and like which we were having we thought that it will be a difficult one, which we can, how we are going through this. And without any hesitation, we started it, ma'am. So we'll just have I'd like to share some experience about this. As we all know that, like, we got some like certain regulations from the INC, how many hours we have to be there, like for each semester, how many days working, and all the vacations and everything. And like uh, till now we like used anatomy and physiology throughout the year, ma'am. Like we thought how we are going to finish within 6 months, like nursing foundation, psychology, sociology. But when like we have made a master rotation plan, so accordingly we have started it. And when it is started, and we felt that it is the best way that we are adopting it very early, and it is an experiential learning for us as a teacher. Like how we are passing through it, it was going like very smooth and all. Like we had a calendar of events, accordingly we had a first semester exam, second semester exam, and all these things. And now we are coming to the part of final exam, which will be held in the February after 22nd. So the things like we teach a subjects the first semester, which like nursing foundation, psychology, sociology, anatomy and physiology. And only we like it has been already clearly stated that what are the things we are going to do in the lab, like the demonstration, which are the things of mode of the teaching should be there. And already the principal ma'am has set up one of the theatre club in this, where they took the initiation and they have performed the role play, and with the students who have participated very actively, and other procedures we have been done. And like we face a challenge in the continuous assessment phase, ma'am. Like It has been given that as attendance 2 marks without any hesitation. Then they said that assignment 10 marks. Then afterwards, it is a certain like that seminars, group project, and all these things. And we have come up with the like thought that giving too much assignment is also not good. So we have made a journals like with the help of the subject in charge of anatomy and physiology. So student has been drawn a wonderful this one like journal they have made it out with the pictures and all. And also we have given the specific assignments like the things where how to assignments for each subject for psychology to sociology to and all these things together. So finally we face the challenge over continuous assessment. But apart from that, we have planned everything. But due to uncertainty of pandemic, so the clinical area was more concentrated on the lab teaching. So which like we don't have a much like injections and all, but basically bed making, vital signs, the other procedures where the students have been expertise and they are doing very well. And we have developed the first aid module based on the Indian Red Cross this one, ma'am. So it was a huge one, but the Department of Nursing Foundation took as a challenge, and it has been reduced according to the topics which has been given in the INC syllabus, and we have made that PDF and we will be circulating among the students, and also we will be taking the demonstration and re-demonstration of the each of the candidates like first aid like basic CPR, then lifting, shifting, all the things which we are going to take it out of. So this was like we got a better experience how we are like we initially hesitated like how it will be possible, what it will be possible. But with the help of the principal ma'am, all the faculties, it is a challenging and it is made us very clear that the things are happening, it's going according to the plan, even though the uncertainty of pandemic is there.
Thank you, Raman ma'am, and thank you, Manju. Manjunath. Manju Chugani ma'am, good morning to you. My faculty's name is Manjunath, so I call him Manju. Sorry, you're also on screen. uh, Thank you, Raman ma'am, for an elaborative and very simple description of the fundamentals requirement. And I thank Manju also to tell what we did. And it was wonderful to have you with us, ma'am. And it is always a challenge doing role plays, simulations. You know, we'll have to get more number of mannequins, cost-effective mannequins, so that all students will have hands-on training. And simulated patients is again a challenge. So if you have a theater club in the college and some students who are good in dramatics, theatrics can be trained to do those means they are patients who will tell ha yahan dard ho raha hai ye. So that kind of simulated environment will be a very interesting way to learn, I feel, and not be boring कि fundamental lab में 2 घंटा खड़े हुए चक्कर आ गए गिर गए. I think this would be a very nice thing which will happen जो हम लोग को होता था, हम सब गिरते पड़ते थे. So I welcome this move कि this new methodologies have come up. And like I like one thing which Raman ma'am said कि videos, you know, मेरे दिमाग में नहीं आया. I was thinking therapeutic communication के हम role play करेंगे, but we can of course show a lot of videos which are available, and we'll follow it up. Thank you, ma'am. Thank you, Manju, and a very warm welcome to Dr. Manju Chugani.
Good morning, everyone. So,
Thank you, everyone.
Thank you, Raman.
Thank you so much, Raman ma'am. Thank you.
Thank you.
We'll continue with the next section.
Yeah, it's pleasure learning from everyone. Thank you.
Very good morning to you all. Actually, according to the sessions, now we have adult health nursing of Dr. Larissa Martha Sams. Manju ma'am, sorry we have given you the schedule, but we are running ahead, so please bear with us for a few more minutes, ma'am. We'll finish this session and we'll be with you, ma'am.
I mean, now this session will be done by Larissa ma'am and then Manju ma'am.
Yes, ma'am. Ma'am, is it okay?
Yes,
Manju
yes.
ma'am?
It will be around then 12 o'clock for me.
Yes, ma'am.
Yes, ma'am.
Okay, okay,
Thank you,
fine,
Manju
fine.
ma'am.
Very
Okay,
sorry, ma'am.
no problem.
Larissa.
Good morning, Dr. Larissa ma'am. Nice to see you after a long time.
Yeah, good morning.
Yeah.
Good
Yeah,
morning,
Nirmal.
ma'am. Yes, ma'am. I take a privilege again to welcome Dr. Larissa Mata Sands. Ma'am is principal of Lakshmi Memorial College of Nursing, Bangalore. Ma'am has completed her UG from Father Mullah's College of Nursing, Bangalore in 1993, PG in the specialty of Medical Surgical Nursing in Manipal, 1997. Ma'am has completed the MPhil in Manipal again in 2000. His doctorate from Vinayak Mission University, Salem, 2011. Ma'am is a member of TNAI, Society of Indian Neuroscience Nurses, Oncology Nursing Association of India, and Nursing Research Society of India and Asian Association of Cardiac Nurses. Ma'am is member. Ma'am is has a very busy schedule because she's a member of so many associations. Ma'am is now a chairman of PG, BOS Rajiv Gandhi University of Health Sciences since October 2021. And ma'am is a steering committee member from 2021 in AGI Skills and Simulation Centers, which is vice president of TNI since 2020. Has participated in the boot camp for selection of training or in basic. In Rajiv Gandhi University, member of Faculty of Health Science, Nursing and Allied Health Sciences in Adunik Nagari University in 2019, certified by PHRP online training on protecting human research participants in 2019, certified by Indian Nursing Council as master trainer for HIV and AIDS and ART training GF-ATM project, and also in other projects organized by Indian Nursing Council under GF-ATM project under trainer for tuberculosis training for nurses. Ma'am has won the first prize in paper presentation in first international and sixth international oncology nursing conferences in 2003 in Mumbai. Ma'am is awarded prize by Manipal University for securing first position in research in MPhil nursing in 2000. Ma'am is co-guide and guide for PhD nursing in Enopoya University, RJHS, Bangalore. Ma'am, thank you so much for giving us your valuable time. I know you're very busy, and sorry for we are a little ahead of time. We had given you 11 and it is 11:30. Ma'am, this will be enabling the sharing for you. You can continue with your presentation. Thank you so much, ma'am.
Thank you.
Ma'am, you can share.
Yeah, sure.
Thank you, Larissa ma'am. Like just talking till you share your slides. Ma'am is a very
Yes, sure.
dedicated, strict, disciplined faculty and a personality in Karnataka. And we all respect her and admire her for that. And I think Madam and Captain Usha Banerjee are nominated members in INC. We had received a letter, so I hope it is right information.
Yes,
And,
ma'am.
yes, ma'am. So it's a matter
Yeah,
of
good
pride.
afternoon. Yes, good afternoon, everybody. I'm really thankful for the organizers for giving me an opportunity to be part of this national webinar, competency-based nursing education. My topic is overview of adult health nursing. I think all of us are familiar for the past so many years, the terminology medical surgical nursing, and it's really a subject or my specialty which is close to my heart. And now we have the terminology that is being changed, adult health nursing. I think there was a talk for a long time that it has to be modified or changed. And here we are with the adult health nursing, which is spread over 2 semesters. It is one of the core nursing subject. If I ask anybody, how many of you like the subject adult health nursing or medical surgical nursing? Many would say yes, it's very interesting, very nice, but it's very vast. Yes, definitely, because it's one of the core nursing subject. I really would say that it falls over all the other specialty subjects where we study many of the basic aspects which we may carry over to the other specialties. The adult health nursing 1, which is placed in 3rd semester, is spread over
Excuse
20
me,
weeks.
sorry, Larissa ma'am, sorry, I'm interrupting. Ma'am, we can't see the slides.
Okay. I don't know.
The same thing, morning. Yes, ma'am.
No.
Now you can click the go to meeting icon down. Yes, ma'am. Yes. And
Yes.
yes, ma'am. Thank you, ma'am.
Yes. Okay. So adult health nursing 1, it is spread over 2 semesters. The first one is in the 3rd semester, which is 20 weeks. According to the credit hours, the theory carries 7 credits, which is 140 hours. And then the practicum, which is spread over skill lab and the clinicals. The skill lab is 1 credit, which is 40 hours. And clinical is 6 credits, which is 480 hours. And total is 660 hours, which is what is the core of the adult health nursing in terms of the 20 weeks, which is spread in the 3rd semester. The core competencies that one expects to be completed is explaining the etiology and pathophysiology, manifestation, diagnostic studies, treatment, and complications of common medical surgical disorders, then performing complete health assessment to establish a database for providing quality patient care, and integrating this knowledge of anatomy, physiology, and diagnostic tests in the process of data collection, identifying the nursing diagnosis, listing them according to priority, and formulating the nursing care plan, performing nursing procedures skillfully and applying scientific principles while giving comprehensive nursing care to patients, and integrating the knowledge. That is a very important thing where one, after completing, you need to understand to integrate the knowledge of pathophysiology, nutrition, pharmacology in caring for patients experiencing various medical and surgical disorders, identifying common diagnostic measures related to the health problems with emphasis on nursing assessment, demonstrating the competencies and skills to patients undergone treatment for medical surgical disorders, identifying the drug used in the treating patients with medical and surgical conditions, and then integrating evidence-based formulation while giving nursing care to the patients. And coming to the units that we can see here, the unit 1, what has been added is the wound care dressing technologies, which has been added. And the concept of health and illness nursing process has been deleted because it is again overlapping with the community health nursing. And unit 2, which is the intraoperative nursing care. Many of the aspects which have been deleted are the last aspect like CPR, which is again repeated, pain management techniques, the suture and suture materials, all have been deleted from the intraoperative care. It is coming in the later units. Unit 3, common signs and symptoms and management, which has been retained as it is. There is fluid electrolyte balances, vomiting, dyspnea, cough, respiratory pain, incontinence, and edema. And respiratory problems, bronchitis and emphysema have been deleted due to repetition because COPD is present. And pulmonary tuberculosis has been deleted as it is covered under the infectious diseases. Then Unit 5, that is disorders of the digestive system, GI investigation has been added as it is a common one. Then Unit 6, cardiovascular problems, invasive and non-invasive cardiac procedures have been added. BCLS module has been added, and blood disorders which were part of this has been presented in the Unit 7. And Unit 7, 8 and 9, there are no much changes. Unit 10, musculoskeletal problems, diagnostic tests have been added and content has been reorganized. Coming to the Unit 11, that is communicable diseases, chikungunya, swine flu, COVID-19 has been added. HIV, AIDS, reproductive tract infections have been deleted as it has been repeated. Genitourinary and male reproductive have been moved to the next semester along with the immunological disorders. Coming to the clinical practicum, clinical learning both in the skill as well as in the lab and simulation and clinical areas. All these things have been given enough and equal weightages. It is not only clinical area, the skill lab and the simulation. All have been given a due weightage in the syllabus. And in the skill lab and the mannequins and simulators, there are some procedures to be performed and develop competencies like intravenous therapies, oxygen through masks, oxygen through nasal prongs, entry mask, nebulization, chest physiotherapy, nasogastric aspirations, surgical dressings, suture removal, colostomy care and ileostomy care, enteral feedings, cardiovascular assessment, and interpreting the ECG findings, and BCLS, ABG analysis, taking the blood samples, arterial blood gas analysis, and interpretation, application of topical medications, barrier nursing, reverse barrier nursing, standard precautions, and ROM exercises, muscle strengthening exercises, crutch walking, scrubbing, gowning, and gloving, orienting to the instruments for common surgeries, and orienting to suture materials, and various positioning. All these things students can learn and practice and develop competencies, not only at the clinical area, mainly in the skill lab, on the mannequins, as well as on the simulators. Clinical postings, it is spread over 18 weeks. The main areas are medical areas 4 weeks, surgical areas 4 weeks, cardiology 2 weeks, rheumatology is 1 week, and communicable diseases, that is 1 week, and musculoskeletal is 2 weeks, and OT is 4 weeks. So this is the clinical posting which is in 18 weeks. The requirements in the medical, you have the care studies, care notes or care presentations, and surgical you have the care studies or care note and clinical presentations. Cardiology you have cardiac assessment and drug presentations, and communicable diseases, care notes, and orthopedic again you have the care notes. So these are the main requirements. Besides this, you have many other innovative methods that one could adopt in the clinical areas, maybe in terms of the presentation of the patients, the teaching for the patients, bedside clinics, so many things that could be adopted besides these things also. But these are the basic and minimal thing that one has to make the students to undergo in the clinical areas. And mandatory modules in the semester 3 is the BLS. The students have to undergo certification after completion of these things. Then coming to the adult health nursing 2, which is placed in the 4th semester, which is 20 weeks. The credits are theory for 7 credits, which is 140 hours. Practicum, again it is skill lab 1 credit, that is 40 hours, and clinical 6 credits and total of 480 hours. And total in the 4th semester it is 660 hours. What is this course designed for? It is to equip the students to review and apply their knowledge of all these basic sciences of anatomy, physiology, biochemistry and behavioral sciences in caring for the patients with the medical and surgical disorders using the nursing process approach. And also they develop competencies required for assessment, diagnosis, treatment, and nursing management, and supportive and palliative rehabilitative care to these adult patients with various medical surgical disorders. The core competencies, as you have in the third semester, same way even in the fourth semesters, you have the core competencies that could be that need to be developed at the end. That is explaining the etiology and pathophysiology and manifestations, diagnostic studies, treatment, and complications of selected common medical and surgical disorders, performing complete health assessment to establish database for providing quality patient care and integrating the knowledge of diagnostic tests in the process of data collection. Identifying and diagnosis, list them according to priority and formulate nursing care plan, performing nursing procedures skillfully and applying scientific principles, integrating knowledge of anatomy and physiology and pathophysiology and nutrition and pharmacology in caring for patients, identifying common diagnostic measures related to health problems, of emphasizing on nursing assessment and responsibilities, demonstrating skill in assisting performing diagnostic and therapeutic procedures, demonstrating competencies and skill to patients undergoing treatment, identifying the drugs used in treating patients with selected medical surgical disorders, plan and provide relevant individual and group health educations on various medical surgical topics, and lastly, maintain safe environment for patients and healthcare personnel in the hospital. The new curriculum of Adult Health Nursing 2, it incorporates in the Unit 1 ENT disorders. Here, the main thing that is deleted is the CE of oral cavity, larynx, and speech therapy, because this is also covered under the oncology, so it has been deleted here. Eye disorders and eye donation has been added here. Kidney and urinary system disorders, placement of unit is shifted. So otherwise it is retained, and diagnostic tests have been added. Male reproductive disorders, placement of unit is shifted to AHN2 from the AHN1. It was in the previously it was in the second year. Congenital malformation has been deleted. Phimosis, epididymis, orchitis have been added. Disorders of burns and cosmetic surgeries. The cosmetic surgery, gender reassignment, special therapies, LAD, vacuum dressing, laser, liposuction, skin health rejuvenation, use of derma filters, all these have been added. Neurological disorders, there is not much change. Immunological, only the placement have been changed to AHN2. Oncology, again oral, colon, including stoma therapy has been deleted because that is a repetition in the GI system. And radiation therapy, ARB regulations have been added. Other malignancies and different therapies have been highlighted. Disaster nursing, respiratory, cardiac emergencies, shock, hemorrhage, pain, CPR. There is a repetition, so they have been deleted. Pediatric, psychiatry, and obstetric emergencies have been deleted and they have been added in their respective specialties. Care of the elderly, common health problems related to all the systems, that is repetition has been deleted and few have been added. Critical care units, biomedical equipment, infusion pumps have been added. Occupational industrial disorders, there is not much change. Coming to the clinical practicum competencies. The learner, the student, will develop proficiency in applying nursing process and critical thinking in rendering holistic nursing care, including rehabilitation to the adult or geriatric patients. That is the main practicum competencies one has to develop. Again, the procedural competencies the one has to develop at the end of the fourth semester is by learning these procedures in the skill lab. Tracheostomy care, instilling ear and nasal medications, bandage applications, instilling eye medications, eye irrigation, eye bandage, assessment of kidney and urinary system, preparation for dialysis, catheterization and care, assessment of burns wound, wound dressing, ROM exercises, muscle strengthening exercises. Yes, these are repetitions from the third semester. Breath working, application of topical medications, administration of chemotherapy, very important procedure, assessment of primary and secondary survey in terms of injuries, trauma care, bandaging, wound care, sprinting and positions, use of assistive safety devices, assessment in critically ill patients, ET tube setup and suction, TT suctioning, ventilator setup, chest drainage, bag and mask ventilation, central and peripheral lines, and pacemakers. So these are the procedures in which the competencies have to be developed by repeatedly performing. The clinical postings, which is 20 weeks, it is spread over ENT areas for 2 weeks, opto area for 2 weeks, renal area for 2 weeks, burns 2 weeks, neuro 3 weeks, isolation 1 week, oncology 3 weeks, emergency 1, and critical care 2 weeks. The mandatory modules in the semester 4 is palliative care. Third and fourth semesters modules, both mandatory and elective, shall be certified by the institutions or external agencies, which is very important. And to complete any one electives at the end of the fourth semester, which is across first to fourth semesters, include human values, diabetic care, soft skills. It's a choice because it's an elective. You have 2 mandatory modules. Electives, it's a student's choice. And procedural skills which are removed from the third semesters are oral medication, IM, intrathecal, counseling, oxygen administration. All these things have been removed because learner spends more time in developing competency of IV injection along with the others. So that is why IV injection have been given primary focus, and these have been covered in the first year, that is the first semester and the second semester of nursing foundation, which are added to third semester, which is the postural drainage, GRBS monitoring, pain assessment management, application of anti-embolism stockings, application and maintenance of sequential compression devices, and skin allergy test. So which are the additional one which were not highlighted before have been added. Assessment. How are we assessing the theory? We have the continuous assessment, which is for 10 marks. Attendance, it is of 2 marks. Written assignments, which is 2, that is 10 marks. Individual presentation, which is 2, 12 marks. Group projects or work report, 6 marks. And VCLS and palliative care, which is 2, 5, 5, that is 10 marks. And they have been converted to 40 so that the computation becomes easier. Otherwise, the marks becomes very minute when you say 10. And this 40 have been converted to 10 by dividing by 4. And pass mark for each module is 50%, then it is considered as a C grade. Sessional examination pattern, 2 sessional examinations per course, exam patterns, MCQs 4, essay 10 marks, short essay 10 marks, and very short essay it is 6 marks. So total it is 30 marks into 2, that is 2 sessionals. So total 60 by 4, it is 15. Practical assessment. Again, similarly, you have the continuous assessment here. Attendance is 4 marks. Clinical assignments is 20 marks. And continuous evaluation of clinical performance is 20 marks. End of posting OSCE, it is 10 marks. And completion of procedures and clinical requirement, it is 6 marks. So the which is converted, the 60 marks divided by 3, it is made into 20. And then pass mark for each module is 50%, again it is C grade. And sessional examination is 30 marks. OSCE is 20 marks, which is of 2 to 3 hours. And directly observed practice, that is DOP, 40 marks, which is of 4 to 5 hours. The total it is 60, which is divided by 2 into is equal to 30 marks. And university examination pattern, Theory it is 75 marks and practical it is 50 marks. So MCQs 12, essay it is 30, short answers it is 25 and very short it is 8. And practical it is OSCE is 15 and directly observed practice is 35 marks. So totally AHN 1 and 2, the theory it is 100 marks, internal is 25 and external is 75, which is the end semester university examination. Practical is again 100, internal is 50 and external is 50. So total is 100 theory marks and practical it is 100 marks. And we have the guidelines given by the Indian Nursing Council with regard to entering of the clinical experiences, which has to be monitored by the respective clinical supervisors and maintained by each individual students as how many days of postings in each area they have undergone. And you have the clinical requirement logbook, how many assignments, how many tasks in the clinical area one has to perform. And clinical logbook you have the procedure that is listed, which area it has been performed and who is the supervising faculty. So all these things have been given to us very ready-madely. So it is only left to us to implement it effectively. So that is what is the main thing. So need to integrate the curriculum in totality. So it is not part by part, in totality with innovative teaching learning methods. Only then we can say the curriculum can be implemented successfully. It is no good having a good curriculum. It is no good having all the method which is listed down. But due to many constraints or things, let us not dilute the implementation part. So who has to implement? It is we, the educators, who need to implement. So only then we can make the students' learning experiences enriched and have a good clinical competencies. Yes, in this COVID era, the DOP has really taken a back seat. So we have many other alternative methods which can taken over, where we can develop the skill of the patient, so that at the end the students are not want of any skill which is lacking or the competency because they were not given a chance to have a directly clinical observation and practice in the area. So I think this new curriculum of AHN 1 and 2 really would develop a good professional nursing student who is competent. Thank you.
Thank you, Dr. Larissa ma'am. Thank you so much.
Yes.
You have explained the theory and practical aspects in a very clear manner. And you also explained about the core competences in adult health nursing. At last, you have also mentioned that how integrated the curriculum is and how it is to be done in very innovative teaching learning methods so that we can enrich the students with all the competencies. Ma'am, if you don't mind, can you on the video? Yeah, we can take a picture, please. Thank you, ma'am.
Thank you.
Dr. Sudha ma'am, would you like to add something?
Yes, like the second last slide I was watching, the challenge is this innovative teaching learning methods. No, I mean it's a big challenge because teachers should know how to teach, and it is a necessity for the new syllabus. Like innovative teaching learning and assessment methods, like what we have the PBLO, problem-based learning. We have flipped classrooms, we have app-based learning. Students are smart, so if it's a learning platform, which actually there's a lot of scope for the companies, yes, computer science-based companies to come into the nursing field, help us develop all these apps and things which will help us to enrich our teaching learning methodologies. And even these modules which they have given, compulsory modules and elective modules, if we have them, where we don't have to teach them, in the end of Saturday half day, some after 5 to 6 p.m. They should be like self-directed learning, where like how we take the NPTEL course and we do it on our own pace and we go and write the exam. So it should be like that. So those things need to come into nursing now. It's high time that nursing also becomes, all the nurses and nurse educators become digital literates. हम नहीं कर पाएंगे तो आई डोंट थिंक इट विल बी, वो पुराना नोट्स लेके क्लास में जाना, some PPT from somewhere, that's not going to work. Students are more smarter than us. And what Larissa ma'am emphasized on was what kind of mannequins you need to have, which procedures need to be taught in the lab, demonstration, redemonstration, and lucky few students who can get to do it in the clinical side. So it's all challenging, and that dilemma of adult health nursing and medical surgical nursing is still there among the med surg teachers. Most of them do not like it at all. So can we represent, and how can it be sorted out? Because on behalf of the med surg teachers, I'm not a med surg teacher, but they don't like this adult health nursing. Whereas abroad, when the students want transcript, they want all the med surg hours to be converted into adult health nursing in their transcript. So it's a dilemma which is not this platform to discuss. I won't take much time. Thank you so much, Larissa ma'am, for your presence here and for your excellent, simple presentation. Thank you so much.
Thank you so much, ma'am. Thank you, Larissa, ma'am. Good afternoon to one and all over. Now, as we are finished with the adult health nursing, we'll come to the last addressing of the course of OBG nursing. So I would take a privilege to introduce the most eminent person here, Professor Dr. Manju Chugani, Dean, HOD of Obstetric and Gynecology and Paramedical Sciences in Jamia Hamdard in New Delhi. Ma'am is a very produce leader, trainer, researcher, and an influential academician with more than 29 years of extensive hands-on experience in area of maternal and child health and university teaching, administration, projects, management, and research. She involves herself in hands-on training of MSc students in field of midwifery and as a national trainer in SBA program. Ma'am is also instrumental in reforming midwifery education, research, and practices. She initiated Society of Midwives. Ma'am has joined the Society of Midwives in India in 2000 and initiated Delhi chapter in 2019. Thereafter, she has launched so many chapters in other states like Rajasthan, Jammu, and Kashmir. Ma'am is a certified assessor in NAC. She's steering group member at State of World's Midwifery 2021 with Contact of Midwifery. Executive member of White Ribbon Alliance of India. Serve as a board member of Midwives Alliance of Asia, MA, for advocacy of midwifery in India. Ma'am is also a member of National Task Force of Nurse Practitioner in Midwifery. Member of Technical Resource Group in Ministry of Health and Family Welfare, Government of India. Ma'am is notable member of University Grant Commission Expert Committee for comprehensive and holistic review of functioning of universities, and she has reviewed more than 17 universities. Ma'am is also an external assessor of NHSRC and dynamic member of 12 national international organizations and has completed various projects with UNICEF, UNFPA, Center for Development of Population Activities, and IDF EPAS. Ma'am has already made a significant contribution in development of skill-based video films related to MCH in partnership with Ministry of Health, Family Welfare, and UNICEF. She has worked with UNICEF in projects in backward districts of Bihar to strengthen the midwifery education in these areas, and model college was created. Ma'am has an expert resource person, chairperson, and organizer for more than 330 workshops, seminars, and conferences. Ma'am is a dexterous in collaboration and networking with national as well as international agencies, for which she has visited various countries like Hong Kong, Australia, London, Sweden, Scotland, etc., etc., etc. He has been associated as a member of Education Standing Committee of International Confederation of Midwives, member of Expert Task Force on Evaluation of Skilled Birth Attendance training modules of Government of India, member of WHO, uh, IMPSC guidelines steering committee group. Ma'am is also travelers in establishing the National Skill Lab at Jamia Ahmedabad in collaboration with Ministry of Health and Family Welfare and Liverpool School of Tropical Medicine, UK in October 2014. Ma'am is an editor-in-chief of International Journal of Nursing Midwifery Research and also member of editorial board of Journal of Asian Midwives, Journal of Community and Public Health Nursing. Ma'am has total 58 publications, 6 chapters, 5 books, 16 guidelines under her umbrella and presented 60 papers at national and international conferences. She has led more than 11 research projects, funded national and international organizations, and guiding 5 PhD nursing students in their research. Ma'am has received 13 awards and appreciation in her field, including the prestigious Mary Gorbin Agent of Change Award for the year 2020. Certificate of Achievement as Most Influential Woman among 51 Most Influential Women in India, Nari Shakti Ko Pranam 2020. Congratulations, ma'am. Certificate of Appreciation for being Nation's Guiding Light in Face of Adversity by News Bureau of India 2020 and Venus International Foundation Award in 2017. Ma'am has certified of appreciation for outstanding role at Vietnam in 2017, Lifetime Achievement Award in 2016, International Midwife Award at Prague in 2014. She is a great inspiration to the entire staff members and has been constant motivation to stand for pursuing higher studies and staff development programs. Ma'am, presently she is a professor and HOD of Obstetric and Gynecology Nursing and Paramedical Sciences at Jamia Ahmedabad, Delhi. She is constantly inspiring and leading the midwifery education practices research by blending her knowledge and expertise in the field of midwifery. Ma'am, really very privileged to tell all your achievements and it's a highly motivation for all the faculties who are listening right now. Thank you so much, ma'am. Ma'am will be sharing you. Please, you can continue the session. Thank you, ma'am.
Welcome, Dr. Manju Chugani. I think for all the participants who are here, you're a role model. And I think everyone needs to have a role model and a mentor in their life. They may be their colleagues or seniors or juniors or teachers. And your achievements are so mind-blowing. And we wish you all the best for your future and looking forward for your presentation. Thank you for accepting our request and being a part of this webinar. And it's because of resource people like you, Larissa ma'am, Dr. Leena and Raman ma'am, and yesterday's speakers, you know, that there are so many participants who have been attracted to attend this conference. So we owe all that to all of you, all the resource persons. Thank you so much, Dr. Manju.
Thank you so much for this elaborate introduction. Actually, it is more than what I am. And thank you so much, Dr. Sudha Reddy, for inviting me for today's presentation. Is it visible, my presentation?
Yes, ma'am. Slides are visible.
Yes,
Visible? Okay. No. Okay, so I think I will not take much time because it's a lengthy session. And how much time I am getting? It's half an hour. Hello?
30 to 40 minutes, ma'am.
Okay, fine. So I'll right away start with the presentation, and I'm also convinced with the previous speakers that we need to take now a multi-sectoral approach to deliver the curriculum which is designed by INC, but we need to have different components. We cannot now confine to only nursing and only the syllabus which is given. We need to take up a lot of things together. So I would be speaking on midwifery, which shows that / OBGY nursing. I'm happy on the word that at least a word is added, that midwifery, and it is before this OBGY nursing, because I feel the content which we see inside the curriculum is 98% or 95% is midwifery only. OBG is only 2-3 topics. So my presentation would cover, slide is changing in your presentation also, on your screen also, no? Is it changing?
Yes, ma'am.
Okay.
Yes, ma'am.
So I will be covering the division of subjects. The layout of the presentation is almost similar to the previous speakers, because it is standardized INC curriculum we are speaking about. So it remains almost same, except that I have added some of the exercises into this, which will be towards the end case scenario, which is one example I have given. We can develop lot of these type of examples. And this, you all of you are aware that the Gazette notification came out on 5th July 2021, and we are starting this session with this new curriculum. And the good thing about this is that it has covered the foundational courses separately, core and elective courses. So it's a combination, very good combination of all the components, and knowledge, skill and practice all are given lot of importance into this. Now coming to the content part, it is our subject is in 6th semester and 7th semester. 6th semester theory 3 credits. By now you know that for theory the 20 hours equals to 1 credit, and this lab is 40 hours 1 credit, and clinical is 80 hours 1 credit. So that's how we have divided this. So it is 60 hours in, or 3 credits in first semester, this sixth one, and 60 hours 3 credits in 7th semester. 1 credit skills lab in both semesters, 1 each, and clinical 3 credits in 6th and 4 in 7th semester. So previous syllabus, theory was 90 hours. Now it has increased to 120 hours, which was required also. Skill lab has been added, that is 80 hours. Earlier the total practical was 420 hours. Now it is 560 hours. So we have increased the number of hours in theory, practical and lab has been added. Now coming to you say in curriculum it is written INC curriculum, it is written objectives, but I have worded it as course outcomes, because when you go for NAC preparation or NAC assessment, then in that case they ask COs and POs. So program outcome will be one for nursing, and course outcomes are different for different subjects. So this we are covering for midwifery, and this course outcomes are nothing different from the objectives which our council has very well spelled out. I have just changed the first word, but rest of it remains same we can present in our NAC inspection also, that we have designed and we follow the course outcomes. And all course outcomes of midwifery are based on the essential competencies for midwifery practice 2019, where ICM has divided it into, earlier there were 7 competencies. Now they have majorly divided it into 4 main parts, that is general competencies, pre-pregnancy and antenatal, care during labor and birth, and ongoing care of women and newborns. So under these four, we have tried to, I think, covered all the components which are given in this slide. So this course outcomes which we are expecting after this course is that they develop knowledge and competence on the concepts and principles of midwifery, acquire knowledge and skills in rendering respectful maternity care during all phases, then develop skills in managing normal neonates and participate in family welfare programs. Actually, family welfare program, I have seen that is given lot of importance and respectful maternity care in the present one. And also professional accountability is given lot of importance here, and effective communication, not only communication with our clients only, but families, professional colleagues, and mutual respect and sharing decision making to enhance health outcomes, because the objective is health outcome for the clients. So once it is done mutually and with everybody's participation, it is more beneficial and more effective. So recognize the trends and issues in midwifery and obstetrical nursing, because health is a very, very dynamic subject which keeps on changing. What I saw during my practical or my internship period is now completely, I would say that there is a 360-degree change in the approach. Not the basic content, birth remains same, physiology remains almost same. Some changes are happening. Like today I was seeing my grandchild. She's just 1.5 month old and is lifting head. We read that 3 months, it takes 3 months. So some of the physiology and milestones are also changing, but mostly it remains for us almost same. We need to they should be able to know the anatomy and physiology, and physiology of normal management of normal labor, then demonstrate competency in providing respectful and evidence-based maternity care for women during all three periods, that is antenatal, intra and postnatal period. Uphold the fundamental human rights. Human rights are also given lot of weightage in this, because ICM is always, from ages they are giving importance to human rights, which we have included in the curriculum, but we need to put it into practice also, human rights. And we need to promote physiologic labor, not only learn the management but learn to promote that. Try that most of the time or maximum deliveries are happening normally, and we are one of the promoter of this. Provide evidence-based essential newborn care, apply nursing process, and describe the methods of contraception and role of nurse or midwife in family welfare services. As I said, lot of role in of family planning is there. Recognize the importance and actively participate in family welfare programs. Provide youth-friendly health services and care for women affected by gender-based violence. Youth-friendly is added into this curriculum, and I think in Sweden, in other countries, wherever we visited, midwives are playing a very important role in youth-friendly services and activities. So now coming to the course outline, which we start with the sixth semester. I think it is similarly presented in other subjects also. I'll focus more mainly on what is added new. So introduction to midwifery, which is 8 hours of theory. Here, I think we had everything. Only thing is RMNCH plus A is added here. Then in second unit, there are total 7 units in sixth semester, 7 units. And anatomy, physiology, of course, they have given little differences there, that the curriculum has been a mixture of, or I can say that it's a blended learning we will be using. Then it will be more useful, because if we provide them the material for anatomy and physiology, because they have learned in first year, if we give it for review, the content, they will come prepared, and we can have interactive session instead of just teaching from the beginning. So we have to change the approach of implementing it. Then assessment and management of normal pregnancy. Here we have added RMC protocol, respectful maternity care protocol, and father's role, which was not there earlier. So now from here, I would suggest that even for studies which we are giving to masters or the group research work of BScs, we should start giving the topics from the newly added components like RMC component. We can take some research work on this, some research work on role of father's role, how important it is, or how many people do are thinking that yes, it is to be added, or is from curriculum point of view, and one study can be from the service point of view. Antenatal care, first, second, third trimester, all three trimesters, and birth preparedness and complication readiness, including micro-birth planning, is added, which was very much taught in the first module of SBA itself to all ANMs also. Since 2005, we have been actually teaching these birth preparedness and complication readiness and micro-birth planning to ANM and the staff nurses who are undergoing skill birth attendant training program. So now it has been added here also. Education on alternative birthing positions. Here also I would say lot of research is required. Now once we are going to teach this, we need not teach this through our, we should not start the from scratch. We have plenty of videos, we have plenty of educational audiovisual aids available for alternative birthing positions, because other countries have been doing it for years and years. So we can take help of it, and then side by side think of doing these studies also. Then physiology and management of care during labor. Here triage and positive birth environment that RMC will add to it is added. And triage was very important thing, because we were losing many mothers because we were not able to do it on the, we were not able to do it right. Just a minute. Yeah, we were not able to do it on a priority basis, that which mother requires the immediate attention, and we were losing mothers. Now it is added in the curriculum. By the time you go out of your college, you will be able to do that effectively. Then physiological birthing and normal birth is in second stage is encouraged, and episiotomy is removed from this normal side, but it has been there. It is there in the seventh semester with abnormal, because earlier episiotomy to every mother is normal. Now it's not taken as normal. So that's one. Then we have other things like postpartum, ongoing care of neonates. It remains almost same. Family welfare services, yes, lot of things are added. Here it is the family planning counseling is given lot of importance here. And in counseling, it is also specifically balanced counseling strategy, which is a practical, interactive, client friendly counseling strategy that uses three key sub aids. It's a set of aids: job aids, visual memory aids, which is called, for family planning. It is given in the family planning toolkit of Government of India. You can visit that module and can see in detail about BCS. Legal and rights aspects of family planning, human rights, youth friendly, as I said, and gender related issues are also given lot of importance in this curriculum. Then teaching learning activities, I think they have tried to give a lot of direction to the teachers also, that if I have to teach introduction to midwifery, then how should I take help of other methods or the education strategies or education and teaching and technologies are also suggested in this. But again, like direct reading and assignment ICM competencies is written. I think if I add here the link to ICM competencies, that will help the students to locate it and read it on their own. Then role play scenario based learning is given. Here I would add another column. Unit is given, unit title is given, activity is given. I would add another column here and would say that we should have some ready-made role play scenario based learning ready with us. A group of teachers of midwifery all over India, I think, can do this assignment and can add another column where we'll have these scenarios and role play scripts ready. Second unit, anatomy. Here also it is the methods are suggested what we can use. In third unit, which is shown as workshop on alternative birthing positions, here I have written that we should take help of international speakers, because it's done, most of the things are done online and we can take help of them. So to explain, because they will explain it with their experience, and we are going into this field as starters, and we are going to start this, and later on after some time I think we will also have a lot of evidence on this. Till that time we should take help of these speakers and do it, and then is the SBA module which we can refer for these things. Am I audible? Is there any problem? Is it fine?
Ma'am, yeah, ma'am, it's all is fine. Can hear you.
Oh,
She's audible.
okay, thank you so much. Fourth unit is on management of labor, where we have to use SBA Lakshya guidelines, Daksh manual, PPIUCD guidelines are also there, and safe delivery app is written here. However, safe app is in next module. So we need to figure out that how we are going to do it. This one, that safe delivery app, we can start in this module also, because initial part is very normal labor, normal pregnancy part. So we can start using it from the sixth semester itself. And then we also have NSSK module for this unit. Then the other one is also same. Mm,
What happened, Dr. Manju?
then this,
Yeah, now it's
yeah. Counseling is one, lab tests are second, antenatal assessment, assess care for normal antenatal mothers, perform specific investigations, then preparation for parenthood, organize labor room, respectful maternity care, perform per vaginal examination. All these are main component practical competencies which we want them to learn. We need to work out on this, that how we are going to do it. We need to write kind of facilitators guide, which we do it in ministry for all our programs, to roll out all programs along with the curriculum. If we are not giving facilitators, or we can say that trainers module, which they should be using and doing it. For example, I would give one example here, that I want to teach you conduct childbirth education classes. Now here, as a teacher, I should get some training program which childbirth education classes or videos I can show, which are the authentic one and are standardized ones. This is one example I have given. That way, I want discussion on with all midwifery teachers actually across India. We should organize that a kind of workshop where we'll come out with the kind of facilitators guide where we'll write for each of these practical competencies that how we are going to achieve them using what. That's what I mean here. And again, the provide youth friendly health services, how, when, where, what exercise, that needs to be worked out now. INC has given a very good very good guidance, but we need to further work on it. And I think if it takes 1 year also, it will be good exercise to do. And something which I really appreciate in this curriculum is that they have given a list of procedures. Examiner, it will be easy for examiner also to refer these 19 procedures. For me also, it is easy to teach what is this these procedures are. And then for the next semester also it is given same way. I think number of procedures are less in next semester. So these are the I think here the urine testing, pregnancy urine testing was not earlier done. Micro birth planning was not done. Monitoring was done. Preparation for delivery was already being done. Active management, placenta examination was also we were doing, but not listed under as such procedure. Kangaroo mother care and PPIUCD insertion. These are the some new things added. Then this is the practicum for 3 credits. And they have very explicitly given the duration also. 1 week posting in antenatal, 3 weeks in labor room, 2 weeks in postnatal. And the things which are newly added are episiotomy, and not added newly is shifted from one place to other, I would say. Then PPIUCD insertion and removal is added. And then that's all related to 6th semester. Then coming to the 7th semester, now since I have 15 minutes left, this is in 7th semester. Basically, we are focusing more on gynecological nursing, obstetric and gynecological nursing. Midwifery part majorly is completed in 6th semester. 7th also some components are of midwifery, still I would say are of midwifery. Then you acquire knowledge and skills pertaining to rendering respectful maternity care, and to high risk women during all 3 phases in community and hospital all settings. Then help students to gain knowledge, attitude and skill in caring for women with gynecological disorders, which is not specifically given which all disorders, we'll see later. Then also identifying deviation from normal pregnancy, initial assessment, management, and then referral of abnormal, all pregnant, labor and postnatal, all 3. Then doing the assessment and management of women with gynecological procedures. Also demonstrate skills in performing and assisting in specific gynecological procedures, as I said just now. Drugs used in obstetric and gynecology are in 7th semester, but some of the drugs, even though it is not written, but we ought to cover because they will be going to clinical area and will be using those drugs. Infertility is here, and with ART given lot of importance. Then coming to the course outline, here also it is same way. Some of the components are like placement is changed, and some are added ones. Rest, I think abnormal, which we were studying, it remains same. Here they have added COVID and pregnancy in intrauterine fetal death along with this. Episiotomy and suturing moved here from the 6th semester. Then fistula is one which is added, and I'm very happy about it, because I was going to present in which Boston, Harvard University. I went to present the about cesarean. They also asked me to present on fistulas, data on fistulas in India. And believe me, I called up so many hospitals, so many doctors, OBGYNs, asking that, can you tell me how many fistula cases comes to your hospital, or how many do you treat? Nobody could give me the answer in numbers. They say we hardly put it into data. We never have paid attention. However, fistula is a real problem in India too, but it is not documented. I think when our students will read about it, at least they will be conscious and will be paying attention to this aspect. Then the fourth unit is on management of high risk newborns and prematurity, post maturity, hypoxic encephalopathy, hypothermia, fever, convulsions, baby of HIV positive mother, AIDS, home based newborn care, and bereavement counseling has been not freshly added but are placed in this unit. And then another is unit added, the next in fifth unit, they have added, this unit is actually from MSN MedSearch, but is now placed in our seventh semester. Teaching learning activities, again, I felt here um, that we need to further work on it. WHO midwifery toolkit is a big document. If you look at the family planning toolkit, it's also a big document. So we need to give them very specific page numbers either for these units, and give them a very clear direction that which one they have to use from this page number to the, when we write GOI guidelines for use of uterotonic during labor, antenatal and antenatal corticosteroids, they get lost. We need to provide them now in next session when we are going to take on this further. This is just an orientation. Further, there should be a workshop where we will design all these things in detail. Similar way, IMNCI is there for unit 4, and fifth is this is related to our ART, and the visit is written that of course there should be a visit and some exposure to ART centers also. Then coming to the skills lab, which is 40 credit and clinical 4 credits here, they have to learn to identify and stabilize and refer the all, I would say, antenatal, natal and postnatal, all three together I will cover. Then they have to learn the resuscitation and post-abortion care and counseling is given emphasis now separately. And initial management, of course, they have to learn of complications and then refer with the first aid kind of management, then refer. Then coming to the procedures, here there are 15, earlier there were 19. The new ones, which are management of complications during case studies and these things are added. Simulation, injection max self they were doing earlier also, but it is proper procedure now. I starting this oxytocin drip, bimanual compression of uterus and balloon tamponade for PPH, and rest of the things, cervical biopsy they have written, but they have not written that it should be assisting in cervical biopsy. VIA, of course, they can do independently, but cervical biopsy is to be assisted. And again, the number of weeks are very explicitly given, that antenatal 2 weeks, labor 2 weeks, postnatal ward 1 week, neonatal intensive care 1 week, and that OB gynae OT and ward is 2 weeks. You can divide it into based on the requirements. Now again, coming to the clinical logbook, the procedures which are added, and in procedure clinical logbook, the page numbers are given and the semester is given, which one you have to use. Then I will not spend much time on clinical logbook, as it is written very well. Each area is written and the procedures are written. Coming to your clinical requirement, which have been, I feel that most of the requirement we got relaxation only, that antenatal from 30 to 20, postnatal from 20 to 15, labor assessment of labor using partograph we were doing. In fact, all I have always asked my students, whatever is the conduction, same number of partograph should be there. And I think practically we should be doing that. For formally or structured way, we can ask them to maintain 10 partographs, but encourage them to do all cases should be monitored with partograph, which they are going to conduct, because they have added 10 observation of conduction of delivery, 10 assist you are going to 10 assist 10, and then you are going to conduct 10. That way they have divided. I think it's good enough to learn, even if you are doing it very sincerely. I feel that if 5 cases also you are doing it sincerely, you can gain competence. It depends on you. So taking it as an average, it has been decided 10. Otherwise, even 5, I feel can make difference if you are really interested to learn. Kangaroo mother care 2, which is added one, and newborn assessment earlier was also there. PPIUCD insertion is added, and then performing placenta examination, which again I would say I was always emphasizing that the number of deliveries you conduct, same number of placenta examination you should be doing, because this goes without saying that you have to see your placenta is complete or not, and monitoring is important component. So all parthographs are to be maintained. And then this is again the requirement, how many care plans, how many this thing case study, case presentation you have to do, the completion of safe delivery app, and completion of SBA module. SBA module, your institution will be giving certificate, like your college will give. And this safe delivery app is with the Maternity Foundation of India. So once you complete it online, it will be generated on its own. So it will be signed by the CEO of Maternity Foundation of India. And SBA module, there are 3 basic modules in SBA. One deals with the normal, second one deals with the complications, and third is on quality assurance. And I am very well versed with this module. In fact, I feel that different sessions are required. One is required for SBA to orient workshop kind of thing, to orient all teachers on SBA, details of SBA module. Then one on this maternity app, which you should use, safe delivery app. And then the WHO toolkit is there. Then GOI family planning toolkit is there. All that requires actually orientation of all teachers also, specifically the our young generation, who is very fast, very smart, very instant, who are picking up these things very fast, but they are not paying attention to the minor details of the implementation part. So therefore I feel that Dr. Sudha is a very senior teacher in midwifery. So all senior teachers of India should sit together and work out these kind of workshops for our teachers of all over India. And safe delivery app also is very well designed. I was involved from the beginning of development of this safe delivery app. This was first time done in Copenhagen, and the lady who designed it in Copenhagen helped us in India too, but we have changed it a lot in Indian setting, because our setup is entirely different from Copenhagen. Going to this postpartum hemorrhage scenario, these kind of scenarios are available with me. We are using in skills lab, our skills lab. this scenario was developed for PPH, where we give the equipment to the students, all related equipments. Then we give scenario like prolonged labor, normal delivery of a healthy baby, active management of third stage of labor, and is already done, and we note that there is 1,000 ml bleeding, and you have checked and found signs of shock. Now you have to deal with this the case. So for this also there is a checklist, complete checklist, that which describes the steps, and each step is given very clearly. If they are this you can use even for your OSCE. You can use this for your developing the role play scenarios, for giving the case scenarios. You can use this checklist, that these points should be covered when you're doing this. So then the faculty's comments and initials will be put, so that they have record of it, that yes, how it was done, and uh, how we can give our comments also and our opinion into this. Internal assessment, of course, was very well explained by previous speaker also. It remains same, that continuous assessment and sessional examination, and total internal assessment remains 25. So it's same for us also. Then coming to the internal assessment guidelines, I would say again it is same, that we give out of 10, but it comes out to be 30, and then we divide it and give it out of 10 as continuous one. Every subject they have added, it's good that they have added 2 marks for attendance. And then the other assignments and other things are there. So based on our subject, it is subject specific also. For us, it is workshop report, which is on alternative birthing positions, which is given 6 marks. So safe delivery app completion is 10 marks. And also the attendance is given everywhere the importance. Then coming to the internal assessment guidelines, and for practical, it is coming out to be similar kind, that 2 marks for attendance, and then subject as per the specific assignment, like direct observation practical. Earlier speaker also explained that how they are giving 20 marks to this as the NOSCE. Scheme of examination also is same, so no need to go into this. Learning resources, which I was saying, this is the area where I want workshops to be conducted, because all ICM documents, whole thing, if you take, it is too much. WHO guidelines, Government of India, NHM website, if you open, you will find lot of guidelines. Then UNFPA documents, safe delivery app, e-learning for maternal and newborn health care, INC website. These two are given. I think they have started now. I have not checked recently. And to conclude this, I would say that a revised curriculum has identified the need of an R, and thus inculcated important components like respectful maternity care, respectful and evidence-based, youth-friendly, and gynecological disorders also, which are very common ones. The curriculum has universalized the credit system and mandatory and elective modules, which is globally used. And this transformation in education will prepare competent and skilled nurses and midwives, I would say, to provide triple S, that is safe, sensitive, and skilled care. Thank you so much for patient hearing. So,
Yeah, thank you so much, ma'am. Yeah, ma'am, thank you so much that we have understood that how we need to be a very multi-sectoral approach. And also thank you for the explaining of what is POCO. And soon we'll be doing a workshop again on POCOs, because that is very important and a new aspect. Ma'am, thank you for explaining about the course outline, all the teaching learning activities, and all the safe delivery app. And ma'am, we in the as a OBC staff, we do a skill drill workshop also, for the regular syllabus which was going on PPH. So we were giving scenarios and all. And now as it is added, we'll be highly and we'll make the students very competitive. And thank you, ma'am, for all the sharing all the competencies and the learning resources. Thank you so much, ma'am. Sudha, ma'am.
Yeah, thank you, Dr. Manju, so much. I mean, it was an excellent session, such a qualitative session. And I mean, such questions which you have raised. It's a thought to be pondered about by all of us. Because we are midwives, similarly, like other specialties also, we know about it, like right from the ICM competencies which they have included and the changed competencies, and talking about respectful maternity care, birthing classes, like I don't know, like इतना huge ये सब चीजें in individually to train the undergraduate students in all this. Fistulas has always been a problem, like very
Yes.
few PG students take up, for
Studies.
scoring to find grade of fistula and all that. Luckily, one of my PGs had done that, but उसके बाद syllabus में भी उतना बस एक छोटा सा word होता है fistula, and that's
Yeah.
such a huge problem which improves the
Yes.
quality of life of patients, mothers,
Yes.
if treated on. And like episiotomy, कैसे सिखाना, like we why a costly dummy, we don't allow the students to touch it only, we sponge में सिखाते हैं. So this is a option for interdisciplinary collaborations where we can ask our in engineering college मैकेनिकल डिपार्टमेंट की कुछ ऐसे फाइबर का स्पंज फ्रेंडली कुछ बना के दो, so that all students practice it. So इतना huge opportunity I think to collaborate with other sectors like you mentioned, कि अकेले तो हम नहीं कर पाएंगे ये सारी चीजें, और मिडवाइफरी को इतना इंडिपेंडेंट स्टेटस देना है इंडिया में, तो हम अकेले नर्सेस और मिडवाइफ्स ये कर ही नहीं पाएंगे. वी नीड लॉट ऑफ सपोर्ट, IT सपोर्ट, डिजिटल लिटरेसी, ऐप लर्निंग, ऐप मेकर्स के साथ MOU. तो ये हम लोग एज टीचर्स ऑफ अ प्राइवेट यूनिवर्सिटी और गवर्नमेंट सेटअप वेरी डिफिकल्ट, बहुत हायर लेवल में इसके ऊपर वर्क करके they need to facilitate all this for us. और सेफ डिलीवरी ऐप डॉक्टर तरुण का जो है मैटरनिटी फाउंडेशन, आई थिंक our 4th year students used it. थोड़े से प्रैक्टिकल इश्यूज थे, आशा भट्ट was the coordinator, he was helping them use it and it has really helped us. There were some few difficulties but we sorted it out. बहुत टाइम लगता है and it has to be monitored. And another thing which I wanted to tell was there's a lot of e-learning content available on various websites on respectful maternity care. That kind of modules need to be done जहाँ हम teachers को बैठ के 2-3 घंटे Saturdays को, Sundays को value added course है, extra है, वैसे नहीं करने का. Like on their own pace the students can go through these apps, then they finish one unit, answer the questions, then only the other unit opens. This type of things we need, we midwives even in the education sector need lot of help and support from the ministry. The government focuses only on the on ground training and on ground work which is going on, but in the educational institutes I think there's lot of support required from the various agencies to help us, and like you said, learning resources, I wrote down that point and kept, I thought we have still 3 more years to go, and in this 3 years if we all midwifery teachers uh, sit down and we you are so
Yearly.
connected
Yeah.
people, तो एक एक प्रॉब्लम को हम सॉल्व करके लाइक इस साल में हम लोग ये 4 चीजें करेंगे, नेक्स्ट ईयर में 4, नेक्स्ट ईयर में और 5. सो वी आर रेडी विद द लर्निंग रिसोर्सेज फॉर मिडवाइफरी फॉर ऑल ओवर इंडिया, पैन इंडिया. And you are so connected in Delhi. If we get funding for developing that, I think it is an excellent scope which I never thought of until unless I attended your presentation today. Because being an administrator, I just scroll through the syllabus, BOS meeting में कभी देख लिया, but today was like a insight कि कितना challenging है, और जो leaders हैं अगर वो ये नहीं कर पाएंगे तो we fail in our leadership. And we need you, we need all the other maternity midwifery teachers across, we need the obstetricians, we need the app developers, engineers. So it's a huge task if we really want to really get midwifery back in India. ऐसा नहीं हो
Yes.
कि ये सब पढ़ें और खत्म करें और pass out and they don't join labor rooms and they go and work somewhere else or go abroad. It's a very challenging session. And I think they should make it compulsory for all the private institutions also to have Laksha accredited
Yeah.
labor rooms or Lakshata. वो है नहीं, because it's not compulsory, so private में होता
That
नहीं,
I can
and if
appreciate.
we don't have that, our students will not learn about different
Yeah.
positions in labor and all that. So there's so many things to be done, very challenging, but you guide us. Let's make a WhatsApp group of the midwifery teachers and work
Yes.
with INC, ministry, and and you gave a very excellent idea कि जितना भी ये जो ट्रेनिंग है फॉरेन मिडवाइफ्स के साथ ऑनलाइन कर ही सकते हैं हम लोग, अभी तो ऑनलाइन का इरा है। मेरे पास इतने रिसोर्स पीपल है अब्रॉड से, पर मैंने कभी नहीं सोचा कि मैं सिलेबस में यूजी सिलेबस में उनको इन्वॉल्व करूं। So I think excellent presentation, eye-opening presentation. Thank you so much and God bless you. Let's do something for the
Thank
country.
you. Thank you. Let's come out with consortium of midwifery teachers
Yes,
after
yes,
this
yes,
presentation. Yeah.
yes.
Yeah. Thank you
Thank
so
you.
much.
Thank you, Manju ma'am. Thank you so much. Sorry for the delay, but really it was a helpful session. Thank you, ma'am. Good afternoon to one and all. Thanks for being patient. And as we are a little late for the 20, 30 minutes, but we have come to the last session of assessment guidelines by Mr. Gavi Isalimat, who is Assistant Controller of Examiner in Kahir in Kale University, and he is also a HOD of Department of Child Health Nursing in Kahir INS. So has completed his BSc Nursing in 2004 in Kale Institute of Nursing Science, MSc in Pediatric Nursing from Sridevi Institute of Nursing Sciences, Tumkur, pursuing PhD from 2016 in Kale University itself. He is having total teaching experience of 15 years. So he is working as Assistant Control of Examiner in Kale University from since 2012 till date. He has achieved a Best Teacher Award in 2016 from the Kale University. So has organized, participated in various health camps by the Department of Pediatric Nursing and outside the university also. During the COVID time also, he has helped in various organizations in giving services. Sir is a guide for the two students in Master of Public Health and MSc Nutrition in JNMC Medical College, Belgavi. Sir has total 14 publications. Sir is also a resource person for various conferences. Sir, I give a charge to you so you can continue with this. And this is to inform you, the link will be shared to you all regarding the feedback. So you all can fill and soon you all will be getting the certificates also. Thank you.
Just wanted to add that I think very few nursing institutions, very few universities will allow a nursing faculty to be a part of the exam section. So we are very proud of Gavi that he is Assistant Controller of Examinations at the exam section at Kale University. And I thought who else, but he would like, since we have implemented, we are in the end of the semester, we have end semester exams from 28th of Feb. So I just told Gavi, if you could explain to all of us are nursing teachers here, it would be good, and we could, ask you, कुछ समझ में नहीं भी आ रहा तो we would really ask you without any hesitations. Thank you.
I thank Principal Ma'am and organizers for giving me an opportunity to speak on this national webinar platform. As I am speaking on assessment guidelines and grading system, assessment, all of us know that assessment involves the use of empirical data on student learning to refine programs and improve student learning. As you all know that assessment play a very important role in the process of learning and motivation. So assessment always it should integrate grading, learning and motivation for our students. So as it is a process of defining, selecting, designing, collecting, analyzing and interpreting and using information to increase student learning and development. So all of us know that there are main four fundamental elements of learner-centered assessment, and the INC revised syllabus has also been made on these four elements. That is, formulating the statements of intended learning outcomes and develop or select the assessment measures and create the experience leading to outcomes and discuss and use assessment results to improve learning. So all of us know that in formulating learning outcomes, the statements about describing intentions about the what students should know and what students should understand and be able to do with their knowledge when they graduate. But when we see in developing or selecting assessment measures, we have to have designing or selecting data gathering measures to assess whether or not our intended learning outcomes have been achieved, which includes our direct assessments and indirect assessment. As you all know, direct assessment includes our projects, products, papers, thesis, exhibition, and performance, and so on. And in indirect assessment, we have self-report measures such as surveys, and in which respondents share their perception about the graduate know or can do with their knowledge. When you see in creating experience learning to outcome, we have to ensure that students have experience both in and outside their courses that help them to achieve the intended learning outcome. So discussing the assessment results, whenever we have conducted assessment, we have the main important role also is that we have to discuss and using the assessment results to improve teaching and learning. So UGC guidelines for grading system, our Indian nursing syllabus, revised syllabus, has used the UGC guidelines for grading system. The University Grant Commission has initiated several measures to bring equity, efficiency, and excellence in higher education system of our country. The important measures taken to enhance academic standards, quality in higher education, which include innovation and improvements in curriculum, teaching learning process, examination and evaluation systems, which beside governance and other matters. So our INC new syllabus, now you see it has come with the using the guidelines of UGC about the grading system. A grading system is considered to be better than conventional mark, as you all were there with a conventional mark system, and hence it is being followed in the top institution in India and abroad. And the importance of this grading system that it will facilitate student mobility across the institution, within and across the country, and it will also enable potential employers to assess the performance of the student. So grading system, that is to bring in desired uniformity in grading system method, computing the cumulative grade average, grade point average based on the performance students in the examination. So the Indian Nursing Council has followed the UGC formulated guidelines. So what do you mean by grading of performance? See, as the name indicates, which is based on the performance of each student that shall be awarded a final grade at the end of the semester for each course. So we are using absolute grading method, and which is used by converting the marks to the grade. Okay. So based on predetermined class interval, UGC has given 10-point grading system, which is used to with pass grade modified. So we have to know whenever we from conventional mark system to we are on choice-based credit system we have come. So here we should know some certain definitions of what you mean by academic year. So what is academic year is what? It has got two consecutive, one odd and one even semester. which constitute total 1 academic year. So choice-based credit system provides choice for the student to select the prescribed courses, that is core, electives and minor or soft skill courses. And a course is defined usually referred to a paper. See, everyone, sometime if you see the INC revised syllabus, in each semester, example of semester one, course one is applied anatomy and applied physiology, and course two is applied psychology and applied sociology. So we should not have to confuse, okay, because course is nothing but it is a paper, okay, paper one, paper two, paper. So usually referred to as a papers, it is a component of a program. All courses need not to carry the same grade. Okay, there are differences in the credits. So the courses should define learning objectives and learning outcomes. A course may be designed to comprise, whenever we say a course, okay, or a subject, okay, it may be designed to comprise of lectures, method, tutorials, laboratory work, field work, outreach activities, project work, vocational training, viva, and seminars, term paper, so on. So whenever you want to say what you mean by grade point, a grade point is a numerical weightage allotted to each letter grade on a 10-point scale. I will be coming for this slide in next slide. So letter grade is what? What is a letter grade? It is an index of performance of student in a said course. So according to the UGC and even the INC syllabus have been given a same letter grades, that is O means outstanding, A plus A, B plus B, C and P and F. A program is an educational program leading to award a degree or diploma certificate. So what do you mean by SGPE? So it is a measure of performance of work done in particular semester only. Example, in first semester only. So if you have got 8 semester, each semester is what? It is a SGPA. So when we completely make a total of all the semester, that is cumulative grade point assessment. So SGPA, it is a measure of performance of work done in that particular semester only. So it is a ratio of total credit points secured by a student in various courses. Okay, various courses means various paper registered in that particular semester only, and the total course credit taken during that semester only. So it shall be expressed up to 2 decimal places also. A semester, each semester will consist of around 15 to 18 weeks of academic work, equivalent to 90 actual teaching days. The odd semester may be scheduled from, it is according to the instruction given by the council guideline, we have to follow. So each university academic starting is different from different university and different state also. So next comes about transcript or a grade card or certificate. So there is a, I think, this all over the across the India, there is a problem with the transcript. So everyone are very much confused. Okay, how to make a transcript actually follow the proper norm. But based on the grades earned, sorry, based on the grades earned, a grade certificate shall be issued to all the registered students after every semester. So that grade certificate will display the course details, that is code, title, number of credits and grades secured along with the SCC of that semester and CGPA earned till that semester. So maybe INC it will issue a guideline what is the uniform that across all the universities they have to follow proper transcript uniformly, that has to be given by maybe in coming days INC will definitely will think of this. So you want to see about the UGC 10-point grading system. So whenever students score percentage of example 100%, the grade point will be given to that is 10. So letter grade for 10 grade point is outstanding. So example here 80 to 89.99% is the student score. Okay, the grade point will be 8 and letter grade is A. So this is about UGC 10-point grading system. For all the nursing courses and all other courses, pass is at the C grade, that is 5 grade point, 50%. For all nursing subjects, the students have to secure minimum 50% marks to they pass, that is C average letter grade. Okay. So for other electives like English and other electives, it is only for P, that is pass uh, uh, grade letter grade, that is about on 4 grade point. That is for English and electives, there may not be any university examination, but we have to see that at the end of each semester, with including English or other some subject or electives of particular that during that particular semester, the marks has to be sent to the university, but that in calculating the grading system, these marks will not be included for counting. So now everyone of us hands off from this year onwards, because as we are following INC revised semester based system, we have to uh, know how actually SGPA and CGPA is calculated. So SGPA is already I said, SGPA is weightage average of the grade points obtained in all courses by student during that particular semester only. Okay. So all courses excluding English and elective. Okay. Even it applies for other courses also. So how to calculate the SGPA? That is computation of SGPA. So as I said, course number, okay, if there is a first semester, we have got 3 course number, 1, 2, 3, means paper 1, paper 2, paper 3. So each paper 1 is having 3 credits, that is C1, okay, and that is next is 4 credits, that is paper 2, and 3 credits for paper 3. Okay. If the student has secured letter grade of A, and the grade point will be 8, as if you see a grade point 8, it is what? A, very good, that is letter grade A. So here the student has secured A letter grade for this course number 1, and grade point he has secured for that letter grade is 8. So 3 into C1 into G1. So that is credit into grade. So that is become 24. So we have to calculate for that 3 courses. So it will be around C1, G1 plus, if you compute, it will be a 70 and divided by total number of credits. Okay, that is here it is coming as total number 10. So 70.10 is is SGPA, that is 7. It is rounded off to a decimal point. If you see a computation of CGPA, how CGPA is calculated? CGPA is calculated with SGPA of all semester to decimal points is indicated in final grade, that is in marks card transcript showing grades of all 8 semesters and their courses or subjects. So CGPA reflects the fail status in case of fail till the courses are passed. Okay, so that is very important. We need to point it out here. So if you want to calculate example of illustration of CGPA calculation, suppose example semester 1 to semester 6. Okay, so total credit point here, credit points are 20 and SGPA of first semester is 6.9, and same for semester 2 total credit points are 22 and semester 2 SGPA is 7.8, and semester 3 total credit hours are 25 and semester grade point 5.6, and so on so on. So here we have to calculate that C1 into G1, G1, that is 20 into 6.9, 22 into 7.9, that is semester 2, and semester 3 is 25 credit points into SGPA 5.6. If you do, I'll calculate around total number of credit hours, so it will be cumulative grade assessment will be 6.73. So everyone, I think they have, all the eminent speakers, they have even discussed about the practical examination aspect. That is, so university practical examination is about 50 marks, and among that 50 marks, OSCE will be 15 marks, and direct observation will be on 35 marks. So OSCE is a type of examination which will be conducted alongside with the viva, that oral examination, both in the internal and final examination. So in coming future days, definitely INC also will give us proper guidelines about the ASCII. So observed practical or clinical, it is final, internal and external examination will also include assessment of actual clinical performance in the real setting, that is including viva and process application and direct observation of procedural competencies. So minimum period of assessment in the clinical area may be for ASCII it takes around 5 to 6 hours. So maybe in coming days, definitely INC will issue the guidelines for properly conducting the ASCII. So everyone, all of us know that what is assessed in the ASCII. But to brief about this, a learning outcome and competencies will be assessed in the ASCII. So that is clinical skills, practical procedures, patient management, health promotion, disease prevention, professionalism, a system-based practice, a personal development, communication skills, and information handling, understanding of basic clinical science, attitude and ethics, decision making, clinical reasoning, international relationship skills. So team work, investigation, this all can be assessed in the ASCII. So if you see example of ASCII guidelines, ASCII is for 15 marks. So what all core competence domains to be examined? So example I have taken here is history taking and physical examination of adult patient and interpretation of findings and results. Second may be monitoring of competencies, like example CVP monitoring. So therapeutic intervention we can include about drug administration. This is only example I am giving, and in or and also for family education and counseling. So minimum there must be number of station is 5. But while in the formative assessment of ASCII, we have got a time. Suppose example, if we have posted the students to particular the ward, that is surgery ward. If you want to assess at the end of the posting of surgery ward, there may be stations become less. Okay, it may be 3 or 4. So depending upon the formative and summative assessment, the stations will be more. So number of stations in 5 and actual stations are 4, and we can have one rest station in between. So time for each station, students should be given for around 10 minutes. So mark for each station is for 6 months. As per competency checklist and allotted marks, so there are 4 stations, okay, one rest station. So 4 into each station is carrying of 6 marks, it will become 24 marks. So oral exam is about 6 marks. So total, if you divide 30 divided by 2, it is coming as a 15 marks. This is about example, just I am showing what example of practical ASCII marks, how it is allotted for 15 marks. So total, as I said, total 5 stations, and 5th station will be a rest station. Example, core competency domains, here duration in minutes and marks, health assessment, monitoring competency, and therapeutic intervention and family education. So each station is for 10 marks, 10 minutes, and carrying 6 marks, and followed for these all 4 stations, it will include 4 into 6, 24 marks, and oral examination is of 6 marks. So if you calculate it, it is coming for 15 marks. Sorry. Example for direct observation of patient for 35 marks. Okay. So we have to have around 35 marks. We should divide up among the each core competency domains, that is health assessment. It includes history taking and physical examination, development of plan of care, that is nursing monitoring, nursing diagnosis, outcomes and plan of action, and procedural competencies like monitoring, therapeutic intervention, including drug administration. We can have like this for 35 marks of directly observed patient assessment plan of care for 1 hour. Okay. So at the end of 8th semester, already every eminent speaker, all speakers have discussed about it. So competency assessment at the end semester, that is university exam at the 8th semester, integrated ASCII, including all 5 specialties, stations based on every specialty, that is 5 specialty that is 5 into 20 marks for each station. It is around 100 marks. So total examiner will be for external 2 and internal 3, one from each specialty. So suppose some colleges are having some difficulties around for the teaching faculty, they may opt clinical experienced staff nurses. They can be given guidelines how to conduct this OSCE and all. You can have integrated learning and teaching method from a college and hospital. You can include the staff also. So objective structured clinical examination is a tool to assess or evaluate student competencies in a range of students based on specific objectives or behavioral changes. So how the examination process will be? Okay, the skills lab is set up with the required number of stations. So we should have proper skill lab set up with required number of stations. So you need to see that students rotate through all the stations to perform the required tasks, demonstrate, interpret diagnostic materials, and respond to short questions or a case study. So we should have typically 5 to 10 stations. Example, if you take 6 stations, okay, for that 6 stations, we have to have 4 basic skills stations and 2 advanced skills with equal time in all the stations. So all students receive identical assessment so that everyone has to go similar identical assessment for each station. So there is a time limit for each station that may be for around 5 to 10 minutes. So an evaluator at each station has to require observation. So all students are assessed according to the same standard and checklist. So we should know that how to do a preparation prior to conducting a OSCE. Before we should see that we have to have minimum, or we have to see about these 6 guidelines. That is, we have to have preparation of scenarios and stations, as all of them speakers, even they have concentrated on this. And candidate instructions we have to give, examiner instruction we have to give, marking schedule we have to give, and we have to have simulated patient or standardized patient instruction and equipment. See, we will see one by one. In creating scenarios and OSCE station, we must have to see that the best stations are created from real clinical cases and scenarios. And we should have a bank of scenarios that can be created by each department by by doing the robust work. As I want to give an example, we have made around more than 15,000 question bank in our Kelly University, that we have done a writing retreat program from all the departments for 3 days. We were sitting continuously at the conference hall. There we have done systematically done question bank for including MCQ, short essay, and long essay. So like this, for even OSCE also, we should have a bank of scenarios, and scenarios are planned for a task accomplishment within the time limit. Okay. So we should see that congruence of the station length with the actual practice. The congruence of the station length with the actual practice is what? Whenever we are giving wound with a dressing, wound care with a dressing. So here the time we need to set how much time within that time the wound care is given and dressing also is done. So congruence of the station with length with the actual practice. So desired time frame of entire OSCE administration has to be monitored. Example, as we were speaking, that we should have a blueprint among before OSCE. So I have given an example here, OSCE blueprint template. We have a scenario that is core competency domain, task domain, and length. Okay. Station 1 is include health assessment. Station 2 is a plan of care. Station 3 is a intervention. Station 4 is a education and counseling. So what task the student has to do perform is in health assessment, take focused history and perform physical examination for patients with the chest pain and breathlessness. So in plan of care station 2, the student will interpret findings developed at a care plan. Okay. In intervention station, we can have a venous cannulation, surgical, just it is an example. Okay. And station 4 must include that breaking bad news. Okay, that is the brain death. So length will for each station will be 10 and each station carries 10 marks. So we have to, this is an example, we have to frame a blueprint before conducting a OSCE. So possible station, already I have discussed that possible station example, history taking, performing physical examination, explaining counseling, breaking bad news, reading CVP using equipment, okay, interpretation of ECG, intubation by using mannequin, CPR using resuscitation, assembling equipment, tracheostomy care using mannequin. These are the possible station example I am giving. So in candidate, second one, in candidate instruction, we should state circumstantial example where the exam is going to be conducted, whether it is going to be conducted OPD, ward or ICU. Specify the task to be performed by each student. Okay, example, take a history, perform intubation. So we have to have specifically the task to be performed by the student. Specify the task not required. Okay, that also because as we have got a very less time frame, we have to have specific task not may whichever not required, that also we have to give to the candidate instruction. Instruct on summing up. Example, tell a patient, tell a examiner, and give 5 minutes for reading time. Example, in station number 2, there is a mannequin. An observer examiner that various equipment and aids to facilitate intubation of the mannequin. So here throughout you have to give commentary for what and why what you are doing. The examiner may ask question. Okay, the mannequin represents a 45-year-old man following the cardiac arrest. Questions may arise that what is the size of ET we will use and what position we maintain during the intubation. In examiner instruction, see that all the students have a copy of candidate instructions and provide specific instruction according to the task. So we have to you must not to prompt while managing the equipment. Example, for measuring CVP, reading with a water manometer. So this is about the skill step that the candidate will identify the patient, explain the procedure to the patient, collect the required equipment, position of a patient flat, attach the water manometer to an IV pole, align a patient right atrium with a 0 mark on the manometer. So we should have clear-cut instruction. And also it is very important after conducting these all marking schedule also we have to ensure that marks are allocated for task for each candidate are asked to perform. Decide relative importance of diagnosis versus process. Okay, we have to have separate checklist for the process. For scoring, prepare marking sheets that simple with the space for comments and placed in the clipboard. This is very important. We should have a simulated standardized patient instruction. That is, standardized patients are well persons trained to stimulate a medical condition in a standardized way, or actual patients we should or who are trained to present their condition in a standardized way. So instruction, we have to have lay persons or student can be prepared for the role of standardized patient. We have to have proper script and specific instruction, that is how to be a general rule, what is that method of clothing, gestures we have to use, emotion, positive and negative answer, and unexpected behavior. So we should have proper simulated and standardized patient instructions. Equipment, whatever the equipment we are using, like chairs, tables, bench, okay, coach, so it has to be beat in detail. Specify mannequins what you are using and specify medical equipment such as stethoscope, BP, manometer, and list the equipment required for performing task and procedure station setup. So this is about OSCE circuit guide station 1, station 2 till station 10. I also want to give an example of OSCE responding. Okay, there may be one station which says that responding to a sudden cardiac arrest. This is an examiner sheet instruction to student. At this station, you are required to respond to a case of sudden non-responsive 50-year-old patient in post-operative ward. It is his third day after surgery. So what the examiner has to note if the student perform, if the student perform the step adequately and completely, we have to give score 1. If student attempt the step but performs inadequately or incompletely, we have to give score 0. If student does not attempt or fail to consider the step, again the score 0. So observation, this is a checklist. So this is looks for an hazards to a self or the patient, that is for 1 mark. Serves to check the patient responsiveness, call for help, check the patient, check for response, look for any material in the mouth and clears if possible with a finger. So on, you should have a proper observation checklist so that every point the student will perform. So this is about an example of OSCE, how we should follow an OSCE core compilation sheet. These all are registration number, name of the participant, station 1 to station 5 and total code. So before the OSCE, the examination superintendent will keep ready the OSCE room with all skill stations. This is very important. Inform the students about their time slot for each OSCE round. And during the OSCE, observe and assess the students' performance. And we have to stand where assessor can see without interrupting and let the student perform the skill. So do not interfere, that is dangerous acts can be discussed with students following the OSCE. We almost always remember that feedback must be delayed until the completion of all stations in the OSCE. This is done in formative assessment only. A feedback can be given in formative OSCE assessment methods only. Okay. In final examination, it is not necessary to give feedback. Okay. Because as there is a time straight. So after the OSCE, in summative assessment, enter the OSCE scores in the summary sheet and send to the university on the same day itself. In formative assessment, review the performance of the student. So we will get a time here. So students share what he or he did well and what could be improved by us. Provide positive feedback and other suggestions for improvement. So, and determine if the student is competent or needs additional practice. This is only done in formative assessment. So summary for OSCE is we have to use a proper blueprint. We have to be clear what we are testing. Pilot feasibility has to be done. Okay, if it is possible, because very important. Train the observers and examiners. So as we are into the new system, many other universities, they are following the OSCE. Some university may not, but we have to have training for the observers and the examiners, understanding about the OSCE principles. We should have a proper plan and also train all examiners together. Okay, if there is any consistency, we have to resolve and maintain the compliance and discipline. So OSCE provides highly structured and reliable methods for assessing knowledge and skills. OSCE requires definitely that time. It requires proper time for planning and preparation for valid station. So till now it was about OSCE. A revised BS nursing internal assessment. I don't go in detail because everyone has been concentrated on this. In first semester, we have got 3 subjects, okay, which has got continuous assessment 10 marks, sessional examiners 15 marks, okay. This is about second semester. In nursing foundation 1 and 2, here 25 plus 25, because first semester and second semester, and practical also 25 plus 25 is equal to 50 in nursing foundation. In third semester, we have again 3 subjects, which is about continuous assessment for 10 marks, sessional examination for 15 marks. So total internal marks 25. So and practical is adult health nursing. So it is also for continuous 20 and sessional exam is for 30. So this is about 4th semester. So I will not go in detail about, because everyone has explained this. So at the 8th semester, we should have practical competency assessment, which is about internal 100 marks and external exam for 100. So total it will be 200 marks. So internal assessment guidelines for theory is 10 marks. So attendance, how it is calculated, that is been given in detail in the syllabus. You can refer all the soft copies of the syllabus. You will have an idea. And this is about the practical. So I don't go in detail about this internal assessment so that everyone has uh, about this university theory examination portal for 35 marks section, for 75 marks section A 37, section B 38. So applied anatomy, applied physiology. Okay. So this everything has been detailed given in the INC syllabus. Thank you.
Good afternoon to all. We have come to the end of this today's webinar. Thank you, Gavi sir. Thank you for giving this informative session on the assessment guidelines. Hope all these sessions were useful to you all. Any queries you all have? Okay. The thing is, we have given the link on feedback and many have already filled. There will be issues in certificates because only 100 will be issued in 24 hours. So yeah, those who have already filled the feedback form and not got the certificate, so please be patient. By tomorrow, you all will get it again. In case if you all don't get it, you all can on the WhatsApp group. Please don't leave the WhatsApp group till you get the certificates. So you all can mail us your message us your email ID and your certificates will be issued. We'll see to that. Okay. Thank you so much. And lastly, to say thank you to one and all, including the all the delegates. Firstly, because until and unless you all register and join and being so patient for us, we could not have achieved that goal today of being a successful, making this webinar successful. And mainly the backbone behind this is the principal, Dr. Sudha Reddy ma'am, who is always on the toes to conduct the some nursing education events, like first event for this year, which we started with this competency based education, and much more to come in the future. So we'll be uh, in the next month again we are planning with the artificial intelligence in nursing. So we'll see that you will be convening to you all. And main thing I want to thank to all the resource persons, especially first from to start with Dr. Rita Lakani, Professor Deepa Reddy, Mr. Prasad Kanavadi, Dr. Sri Vani, Dr. Baby Nayak, Mrs. Sheila Shetty, and today's session, Dr. Leena Casey, because many have complimented ma'am and all the resource persons that all the sessions were good, including Dr. Raman Kalia ma'am, Dr. Larissa ma'am, Dr. Manju Chugani, and lastly, Mr. Gavi Salimat, CEO. He is very busy now because as the exam sessions are coming on, he is continuously in the exam section. So he has given us time in spite of his busy schedule. Thank you, sir. So once for all, I thank on behalf of Principal Ma'am and Vice Principal Dean and all the HODs, because without their support, the session would not be possible. So thank you for bearing with us for these 2 days session. Sorry for today's delay because the discussion was a little longer. So the session went a little prolonged, but we tried to see that. Anyways, thank you so much. If any comments, any compliments you'll want to give, you're most welcome. Thank you, ma'am. And right now, ma'am is had to leave. So, ma'am, so the ma'am principal is not available right now. On her behalf, I thank you all once again and all the resource person. Um, ma'am has a meeting in the board, so she has to leave it. So Anybody has any comment or anything to be which we can improve it later, please. There will be network issues because of the, this network has become a big issue right now. But anyways, we have tried. But was there any network issues? So that it was difficult for you all, because for us this app is very useful from our university side. So we use this only because Zoom is giving us very limitation time. Please, on any of the issues you have faced, want to mention it specifically, I can mention it in the WhatsApp group or mail us personally. We'll see to that in next things we'll be posting. And really thank you so much once again. If anybody wants to share or talk, you all can, or we can just close off. Okay, thank you, delegates. Thank you once again. And with me, my colleague, Mr. Umesh Nandagaon, is there, who works with me in this Department of Nursing Education, is right now here, and he always helps us. We both together, and our backbone is Mr. Kavi sir, who always helps us in this all these events, boosting us. Thank you.